Good morning, everyone. We will be joining in 2 minutes. Sorry for the delay. Good morning, everyone. In the simple, profound act of breastfeeding, we find the answers to our greatest challenges. It is a natural, sustainable, and powerful solution for nutrition, health, and a bond that lasts for a lifetime. Today, we gather to ensure that this act is not protected, but also celebrated and supported by all. A very good morning to everyone present here. I am Mohammad Umair Adnan of 3rd BMS Professional. I am incredibly honored to be your host for this esteemed conference. I am here not just as a host, but as a future practitioner dedicated to nurturing the next generation from the very first breath. Prior to everything, the family of Aruna Education Trust and Ashwini Ayurvedic Medical College welcome each one of you to Baalajeevanam 2025, a national conference organized by Ashwini Ayurvedic Medical College Research Center and Hospital in collaboration with Pediatric Society of India, NEMA. The theme of this year's Baalajeevanam is prioritizing breastfeeding and to create a sustainable support system. The core aim of World Breastfeeding 2025 are to elevate the breastfeeding on the global and national agenda, which means the theme is a call for government, policymakers, and healthcare system to recognize the breastfeeding as a public and developmental priority, placing breastfeeding to forefront of policy, funding, and programmatic decisions. Secondly, highlighting the link of between breastfeeding and sustainability. Breastfeeding is not only optimal way to nourish an infant, but also environmentally friendly and sustainable solution. Breastfeeding reduces footprint by eliminating production, packaging, transportation of formula-based products. The campaign links to United Nations Sustainable Developmental Goals. Third, to build a warm chain of support. The concept of warm chain is central to this theme. It signifies that breastfeeding success depends on a connected and supportive network of peoples and institutions of various kinds. Fourth, promote long-term investment. The term sustainable support system underscores the need of enduring, resilient, and inclusive frameworks. It is not only about one of campaigns, but about creating a support that provides continuous support from the antenatal period through the first 2 years of children's life and beyond. Before moving forward, let's know the importance of Breastfeeding Week. Every year, from 1st August to 7th August, we commemorate the declaration made by World Health Organization and UNICEF in 1990. This global observance celebrates the vital role of breastfeeding in improving the health and well-being of mother and infant, provides unique opportunity for us to promote, protect, and support the breastfeeding as best source of nutrition of infant. Now, let's move forward with the conference by welcoming our dignitaries. I would like to begin by extending my deepest gratitude to our esteemed director Dr. KG Raghavendra sir, who is the director of Aruna Education Trust. Dr. Raghavendra sir's vision and leadership continue to inspire our institution. Welcome to Baalajeevanam, sir. And it is with great pleasure that I also welcome Joint Director Dr. Radhesh, carrying forward a legacy of dedication. Your commitment to the institution and our collective goal is both aspiring and deeply appreciated. Welcome to Baalajeevanam 2025, sir. And a special welcome to our visionary organizing chairman, our beloved principal, Dr. Nagaraja JM, sir. for his unwavering support and guidance in making this national conference a reality. Welcome to Baalajeevanam 2025, Dr. Nagraj sir. Next, I welcome Organizing Secretary Dr. Priyanka Bairagi, whose tireless efforts and meticulous planning have brought the exceptional gathering to fruition. We are truly grateful to have you, ma'am. Welcome to Baalajeevanam 2025, ma'am. Next, we are immensely honored to have leadership of Pediatric Society of India, NEMA, with us. I welcome the President of Pediatric Society, Dr. Ved Prakash Sharma, sir.
Yes,
Welcome
sir.
to Baalajeevanam, sir.
Thank you.
And we have one more renowned personality from Pediatric Society of India, NEMA, Secretary of Pediatric Society of India, Dr. Amol Sheshrao Patil. Welcome to Baalajeevanam, sir. Next, I welcome our distinguished speakers, our expertise in cornerstone of this event. We eagerly anticipate the insights we will share. I would love to welcome the organizing members. I hope it feels nice to see that the reflection of your hard work is paying off. Welcome to Baalajeevanam, organizing members. And last, welcome, but definitely not the least, to our respected delegates. I welcome all the teachers, students, researchers, and to everyone present here who have joined us from across the nation. Your presence and participation are very at the very heart of this event. Next, I would like to welcome Srinidhi Kumar Acharya sir to the esteemed event of Baalajeevanam, who is going to address the keynote of this event. Now, as we move forward, it is fitting that we hear from the guiding force whose dedication and guidance have been a very foundation of this conference. Our esteemed organizing chairman and beloved principal, Sir Dr. Nagaraja JM. It is my immense honor to invite him to the virtual podium to deliver his welcome address.
Om Shri Dhanvantaraye Namaha. Om Shri Gurubhyo Namaha. The most respected, honorable, the trustees of Foreign Educational Trust, the organizing committee of Baalajeevanam, the faculties of Ashwinarth Medical College and students of our institute. Breastfeeding is one of the most natural and essential act for the both child and mother. It is not going to support only with the value. It gain with immunity, emotional bonding, physical and cognitive development. When you go through the Bhagavad Gita, not directly mentioning about the breastfeeding importance, but while quoting in Sloka, Annad Bhavanti Bhutani, where they mention about the importance of Anna. For the child, but baby, the food is milk. In that continuity of this particular sloka, they mentioned Anna, it is going to by Parjanya. Parjanya is by the Yagna. Yagna Rupena, we have to do the breastfeeding. I feel that Yagna is going to initiated by our college in the form of Baalajeevanam. I'm going to welcome all the dignitaries for this session, and we're going to acknowledge your support. I'm going to thank all the organizers providing this opportunity to speak few words about it. Namaste, Jai Hind, Jai Karnataka.
Thank you, sir, for the insightful address. Your words were not merely a welcome, but also a powerful articulation of the purpose that has gathered us here. Thank you, sir, for such graceful insight. The theme of Baalajeevanam 2025 is one that requires not just planning, but genuine passion. We are privileged to have a leader who has poured her heart into this event, and her dedication has been our great asset. I would now like to invite our esteemed organizing secretary, Dr. Priyanka Bairagi, to deliver her address.
Morning, everyone. We are here on the occasion of World Breastfeeding Week 2025. It is worldwide celebrated on 4th to 7th of August, and here we are. We are also celebrating the World Breastfeeding Week as a national conference. The theme of this year is uh, create, prioritize breastfeeding, create sustainable create sustainable support system. So what is meant by creating sustainable support system or prioritizing breastfeeding? If we see last 2 years, there was more focus on creating the focus on creating the supporting the breastfeeding to mother. So on this year, we have the theme like prioritizing breastfeeding. So what is meant by prioritizing breastfeeding is like whenever if you are working in any college or you are working in any business area or a workplace, the breast should have to continue the breastfeeding whenever you go, because it is very important for the baby to develop for his development. Breastfeeding plays very important role. If we see what the baby demand, it बेबी सिर्फ ये डिमांड करता है कि उसको मिल्क चाहिए. If baby is hungry, he will drink the milk. If baby is thirsty, he will drink the milk. If baby is happy, he will enjoy the breastfeeding. So he doesn't accept anything else from us. So we have to give the breastfeeding to the baby. If we compare the baby with us, most of the people think that so today I have holiday, so I want to eat the pizza, I want to eat the burger, I want to eat the any delicious food. But if someone is more concerned about his health, he joined the gym and he calculated that I will eat today this much amount of the calories, this much amount of the protein I have to take. But what about the baby? Baby is expecting only breastfeed. So why we are not giving his breastfeed? So it is our prime aim to give the breastfeeding to the baby. If we see the contents of the breast milk, if we see the properties of the breast milk, it most of the development of brain development of the baby is completed within 2 years of his lifespan. So breastfeeding is very important. Now we have joined almost from 1,000 to 4,400 to 600 people. We are here with us. Uh, Along with this, we have organized essay competition, poster making competition, paper presentation competition. We collected all the data from this competition. So we have the data, but our work is not completed yet. We have to implement it practically. We have to create the support system for all these mothers to establish to prioritize breastfeeding. It should not be happen like if I am working woman and I should not give the breast milk. If I got some time, then only I have to give the breast milk. No, it should not be like that. You should always prioritize breastfeeding. You should not find some alternatives for the breastfeeding. So this is our aim that we should always give the priority to the breastfeeding, not top feed or not the any other animal milk. So all of us should make a place that we should make sustainable support system, sustainable infrastructure policies to support the breastfeeding mothers to create to prioritize her breastfeeding journey. And apart from this, today we have fourth session of different scientific session. Uh, for these sessions, we have four resource persons. So let's see what the thoughts they are going to share with us. Over to you, Dr. Umer. So I think we can proceed with the next session. Thank you so much, all of you.
Thank you, ma'am, for the truly beautiful and heartfelt speech of your words were wonderful and a reflection for immense passion. Now, we have immense honor of welcoming as the apex body of pediatric care in our nation, the Pediatric Society of India is at the front of campaigning infant health. It is with the utmost respect that now invite President of the Pediatric Society of India, Dr. Ved Prakash Sharma, to the virtual podium to share his address.
Thank you. Thank you. I am audible? Am I audible?
Yes, sir.
I am Dr. Vidka Sharma, National President of NEMA Pediatric Society of India. Welcome all the delegates, speakers to this a beautiful seminar organized by the organizing committee of Ayurvedic College, Medical College and Hospital. I welcome and appreciate the management of Asuni Ayurveda Medical College, who just collaborate with us for this knowledgeable seminar. And I congratulate all the speakers in advance for delivering a good lecture on the breastfeeding topic in the week of the breastfeeding, week of 2025. And another thing, this topic is organized by Dr. Abhishek in for the third time. But every time we are delighted by the speakers for a new topic on the breastfeeding. I congratulate all the teams of this organizing committee again for having this beautiful webinar for the purpose of breastfeeding in the breastfeeding week. Thank you.
Thank you, Dr. Ved Prakash Sharma, for that powerful and inspiring address. Your words have truly set a magnificent tone to this event. Now I would like to call Dr. Srinidhi Kumar Acharya. It is with immense pleasure that we now come to pivotal moment of our conference. We are honored here to welcome a distinguishing luminary in his field, Dr. Srinidhi Kumar Acharya sir, as an esteemed associate professor in the Department of Kamara Bhratya at the National Institute of Ayurveda, Jaipur. Dr. Acharya brings over 21 years of dedicated teaching and 23 years of research experience. Holding an MD, PhD, he is distinguished alumnus of both Banaras Hindu University and SDM College of Ayurveda. A prolific author, he has published a two-volume textbook, guided over 20 research papers, and contributed more than 40 articles to various journals. Beyond his academic work, Dr. Acharya is an active consultant Ayurveda pediatrician whose passion for child and health Ayurveda awareness has been featured on televisions and radios. We are truly privileged to have Dr. Srinidhi Kumar Acharya sir as he delivers his keynote address. You may proceed, sir.
I want to. Am I audible?
Yes, sir.
Srinidhi sir, namaste.
Namaste, sir. Namaste, namaste. So, share window. So, slide is visible, sir.
Yes, sir.
Okay.
Sir, no, your slide is not visible. Please try again.
Okay. Okay. Huh? Is it visible now, sir?
Yes, sir.
Okay. So, is it visible now?
Yes, sir.
Okay, sir. Thank you. मूकोऽपि यत्प्रसादेन मुकुन्द शयनायते राजराजायते रिक्तो राघवेन्द्रं तमाश्रये ओम श्री गुरु राघवेन्द्राय नमः. At the outset, I would like to thank the principal of the college and all the organizing members of this Baalajeevanam and president of NEMA and other members for giving me this opportunity. Thank you very much. So, wishing all the best for your seminar. I would like to deliver the keynote address, and which I consider myself fortunate to deliver the same. Anyway, the topic is prioritize the breastfeeding and create certain sustainable support system. Now, talking about breast milk, as everybody knows, breast milk is considered as best milk. So it is best milk in many regards because it is best because it is the main source of nutrition to the infant and newborn, and it is a source of maternal bonding, and it is the one which takes care of the psychology of the child. It is also one which fulfill all the demands in the early infantile life, and moreover this is very good for the brain. And talking about the brain growth, there is no other nutritional products, or rather say nutritional resource, which is better than the breast milk to to facilitate a very good brain growth of the newborn. The reason is very simple, because the first 2 years of the life, the brain growth will be maximum, and there is formation of number of neurons and interconnections in the brain, and it is only the breast milk which contains a required amount of these substances, rather raw materials, which is required for the brain growth. If you try to provide the same from the outside, it is quite impossible to find all those requirements at a single material. But breast milk is do the magic, because it contains all the essential proteins, lipoproteins, carbohydrate, which is required for the development of the neurons, especially some of the essential non-essential amino acids, and as well as essential fatty acids. So we cannot find such another nutritional resource which is so good for the brain, that too also in the first 2 years of the life. So if we are denying the breast milk in the first 2 years of the life to the baby, definitely we are hampering the brain growth. So you can give the outside milk in the form of the top milk, in the form of the animal milks, but animal milk is only for the body, and breast milk is always for the brain. So if you want to increase the intelligence of the child, yes, you should go for the breast milk. And if you only want to increase the weight of the baby, yes, you can go for the animal milk. This point has to be made clear to the mothers and all the family members. Do you want to have an intelligent boy in future, or do you want to have a stout boy or offspring in future? Another important thing is breast milk is very good for immunity. As we know, breast milk itself is sufficient to prevent so many infectious disorders, including so many viral disorders, many bacterial infections and parasitic infections. Not only this, breast milk also sensitizes the immune system for future development of the antibodies. So these are some of the great benefits of the breast milk. And this has to be made clear to the mother and as well as the family members that this is the best milk, this is best for the brain, and this is best for the immunity. Not only now, for the future also, because brain growth has got a future impact. Okay, so you cannot increase the intelligence of the boy or cognition level of the baby after the age of 10 years, and it has to be done in the first 2 years. One of the best way to achieve this is providing the breast milk as far as possible. Nowadays, the WHO also says that if the breast milk is there, you continue to provide the breast milk to the baby up to 2 years. The concept is 1,000-day care of the baby has been now very much popularized, starting from the conception and first 2 years of the life. If the breast milk is available, yes, go for it. Of course, for the first 6 months, it is exclusive breastfeeding, and there onwards, we have to shift for the other food also. But if the breast milk is available, don't deny it. Give it up to 2 years, because up to 2 years, the brain growth is continuous. So up to 2 years, we have got by 2 years, 90% of the brain growth will be achieved. And in this time, if you provide a material, nutrition material, which is very much rich in substances required for the brain growth, then this is a natural gift. And if you are actually denying it, definitely our, that means common sense has to be questioned. Another important thing is species specific and baby specific nature of the breast milk. See, God has provided such a beautiful resource of nutrition to the newborn, which is species specific and baby specific. What I mean to say is, breast milk is species specific. For the humans, always you prefer human breast milk. For the animals, we always prefer the animal breast milk. So that means if you give the animal breast milk for the humans, it is not fulfilling the criteria of species specific. For the human baby, we have to provide the mother's breast milk. That is the right one, because it is species specific. The reason is, if you give the cow's milk to the humans, the cow's baby of the cow after delivery, it will get up in 5 or 10 minutes, and by within 10-15 minutes it is running. That means the growth process is very fast in animals. Therefore, the milk of the animals which is produced is also according to that. Therefore, they contain high amount of the proteins, high amount of the calcium, phosphorus, etc. Whereas a human baby start walking after the age of 1 year. For running, it will take about 2 years. So that means the growth process is sustainable and as well as very, very slow. So accordingly, we have to provide the nutrition. Now, if you give the human breast milk for the human baby, then it is very conducive. The reason is the nutrients which are present in it is according to the growth and development of the newborn, according to the phase of the growth and development of the newborn, unlikely in case of animals. So therefore, when you give the cow's milk to the newborn, we have got a lot of problems. We have to reconstitute it and we have to humanize it, which is a very lengthy process. Similarly, baby specific. Another beauty of the breast milk is it is baby specific. That means if you have got the preterm baby, the breast milk of that preterm baby mother is according to the need of the preterm baby. If it is a postterm baby, it is according to the need of the postterm baby. And if it is a term or low birth weight, it is according to the need of the low birth weight baby. So this much of flexibility and the benefits are not there in any of the breast milk. Therefore, we always say breast milk is species specific and as well as baby specific. There is no need to try something other in the preterm baby. If you give the breast milk of the preterm mother for the preterm baby, it is sufficient because it contains high amount of the proteins and whatever things which is required for the early growth or proper growth of the preterm baby, it is there in that milk. So therefore, we always say that baby specific and the species specific nature of the breast milk is the beauty of a breast milk. Another one is maternal bonding. Now, this is very important. There is no other way which create a strong maternal bonding other than breast milk feeding. Now, whenever the baby is feeding or sucking the breast, it always watches the face of the mother. And this is how the maternal bonding develop. Now, only thing is mother also has to look at the baby while she is feeding. Otherwise, this bonding will not develop. Okay, so this is one which produces strong maternal bonding. So which is a lifelong, which has got lifelong impact. Okay, lifelong impact. So strong maternal bonding is possible only by means of breastfeeding. One more interesting thing is breastfeeding is not only for the nutrition, not only for producing strong maternal bond, it is also fulfilling some of the psychological aspects of the baby. For example, if you look into Sigmund Freud's psychosexual gratification table, so there we find that in the first 18 months of the life, the baby is having an oral phase. That means it puts everything into the mouth, and this is one of the way of getting sexual gratification. This is according to Sigmund Freud and Eric Erickson's module. Okay, so now feeding the baby, that is breastfeeding the baby, is one of the way of getting a sexual gratification which is present in that stage. See, this sexual gratification will be present in different stages in a different way. We have got oral phase. Oral phase, the sexual gratification always takes from the mouth area. Okay, then we have got anal phase. In the anal phase, sexual gratification will be taken by the baby or done by the baby through the anal area. So, like in the different phases, baby uses different methods. So, in the early part where we go for exclusive breastfeeding, the sexual gratification will be taken by mouth, and if you are using this mouth for the breastfeeding purpose, okay, then along with the nutrition and other important benefits of this breastfeeding, it also takes care of the psychology of the child, because if the sexual gratification is not fulfilled, so that will have got a wrong impact in the future life, personality development, behavioral development, etc. So this breastfeeding also takes care of that part also. Personality development is one more important thing. Now, strong maternal bonding and sexual gratification through the oral phase by breast sucking the breast or nipple. So that also help for the future personality development. Okay. Next, prioritize the breastfeeding. One is advantages of breastfeeding. So yeah, yes, why we have to prioritize the breastfeeding? The reason is there are a lot of advantages of the breastfeeding, starting from the fact that it is available in the desired temperature, it is available round the clock, it is free from the contamination, it is a complete food, and it is a complete nutrition. There is not even a need of giving the water to the baby, because breast milk contains about 90% of water, so it also pacifies the thirst. So many things are, these are all the advantages of the breast feeding. Okay.
Excuse me, sir.
Yes.
Sorry to interrupt, but your slides are not changing.
Yeah, no problem. Yes. Okay.
Thank you, sir.
Yeah. So there are many benefits, or what you say, benefits of the breastfeeding also is there. Uh, is it changing now?
Yes, sir.
Okay. So there are, as I told, there are so many advantages of breastfeeding. Similarly, there are so many benefits of breastfeeding. Usually, we will divide these benefits into 3 or 4 types: benefits to the baby, benefits to the mother, benefits to the father, and benefits to the society and country, and also benefits to the globe. Now, talking about benefits to the baby, yes, it is very important for the brain growth. It is optimal nutrition, and it is the one which imparts complete immunity. It sensitizes the immunization technique. Then it provides that means provides a free, very strong maternal bonding, and it also prevents so many infections and incidents of the constipation and diarrhea like GAT. Disturbance is also very less, and baby is steadily gaining the weight, and brain growth will be proper. These are all the benefits to the baby. But similarly, there are so many benefits to the mother also. Now, one of the very important benefit to the mother is the fat which is deposited during the antenatal period will be get burnt in the process of production of the breast milk, and that helps to prevent the obesity after delivery, and also it also gives a good shape to the mother. And second benefit is breastfeeding also prevent the uterine bleeding by proper involution of the uterus. And further, it is also helpful to prevent the uterine cancers in future, ovarian cancers, and also cervix cancers. So these are all some of the very important. More importantly, it helps to prevent the breast cancer. Okay, so these are all the benefits to the mother, and there should not be any misconception that breast milk will going to disturb the body figure. No, it is vice versa. A proper breastfeeding will going to give a proper body shape to the female in future, because the extra amount of the fat which is deposited so will be completely burned down in the process of production of the breast milk. Now there are benefits to the father also. Yes, country like India, developing countries where maximum people are there still economically struggling. That being the case, providing an outside milk, any formula feeds or infant formula milks, is quite expensive, and in spite of that expensive workout, uh, it is not able to impart the desirable effects. But breast milk, which is naturally available, not only saves the money for the father, and also it gives a complete benefit. Similarly, benefits to the society and country. Yes, we know that the benefits of breastfeeding for the future country citizen is a lot. For example, the child which is exclusively breastfeed up to 6 months, or feeding up to 2 years, then he will have the less chance of hypertension in future. That baby will have less chance of diabetes in future, less chance of autism, ADHD, then so many contamination, non-contamination disorders, non-communicable disorders. So he will have higher levels of intelligence, and he will have higher level of personality and behavioral development. So these are all the benefit, and these benefits are not only for the parents, these benefits are not only for the baby, these are the benefits to the society also. So when you have a disease free population, and you have got a more intelligent population in your country, that is a gift to the country, and definitely that country will progress in future. So this is the benefit of breastfeeding to the society and to the country. Yes, globally we will have a healthy society. That is the global benefit. So likewise, all round benefit has been seen by the breastfeeding, simple act of the breastfeeding, which is otherwise a natural process. So this has to be facilitated. Therefore, we have to prioritize the uh, breastfeeding. Unfortunately, even in this advanced era, also we have to give the message every year that go for breastfeeding, go for breastfeeding. Now, this should not be the case since so many centuries we have been practicing this. And if you go back 50 years back, there is no need of sensitizing the people as we are doing nowadays. People were, although little less advanced in those days, they know the importance of the breast milk, and none of the child has been deprived of breast milk if you go through the history 50 years of the back. But in the last 50 years, the scenario has been changed. I don't know why. And even we have got all the educational training going on, advanced methods, we are more educated, and we are living in the modern society. But still it is quite unfortunate that every year we have to give the message that go for breastfeeding, go for breastfeeding. So this is quite unfortunate. Now coming to the next part, sustainable systems. Sustainable systems. Now, yes, we have priority should be given to the breast milk, and it should not be denied. It is a right of the baby, and we are doing a big mistake if you are not providing it. That's over. Now talking about sustainable system. So how you can make sure that this breastfeeding is available for the baby. Number one is the we have to understand the importance of breast milk. That is very, very important. Now, if you look into the general public, general public is very much concerned about the weight of the baby in the first 2 years of the life. Every mother is worried, my baby is not gaining the weight, the neighbor's baby is very, very healthy and stout, but my baby is very thin and lean. So these complaints will be often raised by the parents, but none of the parents will raise the complaint that my baby is whether my baby is gaining the proper intelligence cognition level or not. Now this is one thing which is lacking in the society. We are much aware and concerned about the weight of the baby, but not about the brain growth of the baby. Okay, now it is actually vice versa. You can attain the weight in the later parts of the life also. Okay, achieve the proper weight in the later parts of the life also. But this cognition level, once you miss in the first 2 years, you cannot achieve it, because 90% of the brain growth will be over by 2 years. So there is a need to understand, convince, or stress this point to the parents that it is not the weight which is very important. Yes, you should have a normal weight, but it is not so much important that you have a hefty baby or a stout baby. Rather, you have to give more importance for the intelligence, which you cannot achieve later. So give breast milk now. So this, we have to touch the heart of the parents by telling this truth, that if you want your baby to have more intelligent person, or you want to have a more stout person, so then only they can understand the importance of this. But unfortunately we are not doing. Usually we find that only after 3 years mother used to come to us, my baby is not standing up, my baby is not understanding, my baby is not picking up the letters, and he's not achieving the social and the language milestone. So these problems, they come later at 3 years. But in the first year, in the second, from the second month itself, they start, my baby is not gaining the weight. Okay, so he's very thin compared to other babies. So this awareness which is there regarding the weight should be shifted to the awareness towards the intelligence, and attaining the intelligence is only possible through the breast milk. This message has to be conveyed very clearly. Second important thing is sustainable system. Counsel the primary mother during the antenatal visit. Now, very important. So, a primary mother or any mother, the counseling and motivation should be started from the antenatal visit itself. Every antenatal visit, we have to motivate the mother. Okay, so it is not that only after the delivery everybody start coming and telling the primary mother, you go feed the baby, feed the baby, feed the baby. The mother will be confused because she is not mentally prepared for that. But instead of you, if you motivate the same from the antenatal period, she is well prepared, and at the time of the delivery, she will be ready to give her 100%. Next, early breastfeeding. Nowadays, early breastfeeding is also important. So, if you delay the breastfeeding for 1 or 2 days, or even after 2 to 3 hours, then it has what its impact. Okay, many impact, because the reason is breastfeeding or production of the breast milk is directly related to the suckling of the baby. Okay, how much baby used to suck, how much babies, how early baby starts sucking. So that plays an important role in the production of the proper breast milk. Therefore, early breastfeeding should be started, and this is very important for the baby mother relationship. Bonding also, it is very important, because touch of the baby, then smell of the baby, then the sound produced by the baby, they are the real stimulators for the hypothalamic pituitary mammary axis. So we should ensure that these things will be there from the beginning itself. Now, talking about one more thing is isolation of the mother and baby. So immediately after the birth, mother and baby should be isolated, okay, from the other family members, because we have to give the privacy to the mother and as well as a baby, so that so they have to conversate many things, okay, verbally and non-verbally, and that plays a very important role in promoting the breast milk. Now, suppose if you're not providing a privacy to them, okay, so then also it will limit the production of the breast milk. So there is a wrong notion that mother and child should be separated. And what people will do, they separate mother and the baby. Mother and baby as a unit should be separated from the others. Not the mother and baby should be separate individually. Okay. So then home environment is very important. In the home environment also, how much privacy you give to them, how you will motivate them, how much the moral support will be provided from the other family members. So that plays a very important role. See, every home is not similar. There is change in the mentality. Female like the male babies, female like the female babies. So if the baby is against to their wish, then they may not motivate the mother, or they may not give the proper support. So these minute things will play a very important role in the production of the breast milk, because rather, see, production of the breast milk is not a mechanical process. Production of the breast milk is a hormonal process, it's a psychological process, it is a mechanical process, it's a combination of all. But more than all, more important is it is a psychological, because all these hormones related to breastfeeding like prolactin, etc. So basically they are produced from the hypothalamus, which works better only when the mother is cool and relaxed and happy. Okay, so once the mother is not cool, not relaxed, not happy, then all this cycle will going to disturb, and you don't expect any proper breast milk production. So this point has to be kept in mind. So providing a congenial, healthy home environment is very, very important. Now, one more thing is night feeding. We have to encourage the night feeding. Breastfeeding should not be avoided in the night or limited in the night. So usually what happens is in the night whole for 10 or 12 hours, we will give only 1 or 2 times breastfeeding. Rather, it should be given for maximum times because production of the prolactin will be maximum in the night hours. Okay, and if the breast is emptified, then meantime the prolactin is also produced, the breast is also emptified, then the production of the breast milk is more. Okay, so if the breast is always full, then negatively because of negative feedback system, the prolactin production will be also stopped. Okay, so production of the prolactin is maximum in the night hours, so maximum times we have to emptify the breast milk in the night hours. So then again the mother will have a proper breast milk production. Meanwhile, in the breast milk, there are three parts: foremilk, mid milk, and hind milk. I think everybody should know this. And foremilk is very rich in carbohydrates and water. Mid milk is rich in proteins, and the hind milk is rich in fat. Now, emptifying one breast completely before shifting to the another breast is important for this reason. Okay, so total emptification of one breast may requires about 15 to 20 minutes. In the first 5 minutes, the milk coming, it is called as fore milk. In the next 10 minutes, 5 minutes, it's called as mid milk. In the last part, it is hind milk. Now, if the baby is not getting the hind milk, baby is not getting the fat, and again, the weight gain will be badly get disturbed. And if the baby is only getting the fore milk, it is only getting the carbohydrate and the water. There is no question of protein and what you say fat. Again, the health of the baby will be get affected. So mother should be trained on this, that it contains three types of the milk. Okay, if you don't provide all these three types of the milk in the phases like fore, mid, and hind milk, then it is not a complete feeding. Complete feeding. So this point has to be realized to the mother. Then maintain the hypothalamic pituitary mammary axis. As I told earlier, this is only possible by keeping the mother happy and relaxed and cool. Okay. Now, very important is avoid the visitors. Of course, it is quite difficult, but however, you have to avoid the visitors. Visitors not only disturb the privacy of the mother and baby, but also they are the one who who will going to bring so many infection from outside. Okay, so every time it is quite impossible to tell them to wash the hand and then touch the baby. So there are so many problems will be there. So they are the one who brings the hygiene. They are the one who disturbs the baby mother maternal bonding, and they are the one who disturbs the privacy of the mother. So all these things will have bad impact on breastfeeding. So similarly, there are some other things like in the antenatal period itself, we have to check the the breast, or examination of the breast of the mother has to be done, or pregnant lady has to be done, because there may be some structural problems related to the breast. For example, nipple problems, inversion of the nipple, eversion of the nipple, and improperly formed tits, etc. So if you are identifying these problems after the birth, then again it will going to disturb the breastfeeding. Rather, these problems has to be identified prior to the birth of the baby in the antenatal period itself. Then we have got sufficient time for the correction and also sufficient time for the counseling and training the mother after birth what she has to do. Okay. Now, therefore, important is you give two options to the mother, whether you want intelligent child or whether you want a stout child. Okay, then naturally she will come to intelligence, and this is one of the way of motivating her or making her aware about the importance of the breast milk. Then also highlight the importance of maternal bonding. Nowadays, maternal bonding nowadays, that means children leaving their elder parents in the old age home is quite common. And you can make her realize that if you do not develop the proper maternal bonding, definitely in your old age he will not take care of you. So such type of words, okay, so may touch the heart of the mother, and she will be willingly she will go for the breastfeeding as far as possible. Educate about the timing of fore, mid, and as well as hind milk. This I already explained. Similarly, educate the proper techniques of breastfeeding. That is also important. Mother is now ready to feed, but she don't know the techniques of feeding. Okay, how to hold the baby, where should be the mouth of the baby, what should be the position, okay, what are the different positions used for feeding the baby, what we have to do in case of twin babies. So this education has to be given to the mother. You can arrange a training program of a few hours or 1 or 2 days for that also. That is quite good. Positive inputs is very important. And suitable environment is very important. See, the feeding is not possible in between all the people. Okay, they need privacy. Okay, because as I told, it is hypothalamic pituitary memory axis. So mother has to be ensured. Mother should feel secure, relaxed, and cool. So in between 10 or 15 people, mother cannot go for the feeding. Okay, that badly going to affect. If there is any distractions, so TV is running, mobile is running, so these are all the distractions which is there for the breastfeeding. Mother and child should have complete isolation and complete privacy. That is required. Total silence is very much required. Similarly, we have to go for the family support and as well as society support. That is important. When I talk about society support, if the working mother is there, she should be given some facilities in the working area. Also, a private room should be there. Crutch facility should be there. So nowadays, this has been made rule by the government that you have to provide all these things. So similarly, encourage the mother to take care of the baby herself. This is very important. Nowadays, what happens is after the delivery, mother think that her duty is only to feed the baby. Rest of the things will be taken care by the others. No, a strong maternal relationship bonding will develop, and even the breastfeeding will be also more. Production will be also more when mother herself take care of her baby. It may be quite strainful to the mother in the beginning days. Somebody can help her, but later onwards, after 15 days or 1 month, definitely mother has to perform all the duties of the baby. Okay, so starting from changing the diapers and if possible giving bath to the child, giving massage or abhyanga to the child. So this has to be done by the mother itself. Then it not only increase the production of the breastfeeding, increase the maternal bonding, affection towards the mother, but also it helps to burn down the fat which is present in our body, which is deposited in the antenatal visits. Okay, so this is, if you don't take care of your baby, if you don't take care of your baby in the first 2 years, then he will also not take care of you in your olden days. That's all. That's the truth. Now, compulsory workshop and training on the breastfeeding and baby care during the antenatal visit should be provided to the mother, especially to the primary mother. Okay, about the primary mother, we have to take little care because immediately after birth, you can impose so many things on her. Okay, so you have to feed, you have to take care of the baby, you have to do like this, like this. So instead of that, in the antenatal period itself, you give continuous training, then she will be motivated and mentally she will be ready. Now, how to take care of the baby? The mild music may be there. That is quite good. Pleasant music is always good. And there is a concept of white sound. So baby will be comfortable in the white sound area. White sound means, see, in the uterus, during the 9 month of stay, what actually happens is baby is habituated for the sound. That sound is produced by the flowing of the amniotic fluid or movement of the amniotic fluid and flowing of the blood vessels. That means movement of the blood in the vessels. So baby is habituated in the uterine vessels. I mean to say uterine vessels and all. So baby is habituated for this particular sound, and that sound is called as white sound. And even after the birth also, when you are taking the care or when you are feeding or when the baby is sleeping, you have to provide an artificial white sound. In the sense, suppose a fan is running in a little slower mode, so that produces a white sound. Okay, instead of absolute silence. See, baby do not want absolute silence. Okay, it want a sound which is called as white sound, like the running of the fans and all, which is almost all simulating the same thing, that sound which is produced in the fetal period. The fetal period by the sounds like this amniotic fluid movement and as well as the the movement of the blood in the blood vessel. So this is quite comfortable to the baby, and this sound is called as white sound. Okay, so we need to produce such an artificial environment so that baby will be very happy and comfortable. Avoid mobile during the baby care. Very, very important nowadays. Mobile, TV, and other social media we have to keep, because when you are feeding the baby, baby is watching your face. But reciprocally, if you are not watching the baby, then that contact will not be developed and a proper maternal bonding is not possible. Then it becomes a mechanical process. Okay, baby is watching you, and baby is also watching your facial expression when you are feeding. Okay, so that is very, very important. That eye contact is very, very important. Uh, so create a similar environment, uh, just like that of the uterus. Maybe when you are, that means when the baby is sleeping. So in the uterus, it is in the flexed condition, or in the flexed position in a very small area. Okay. So similarly, even after the birth, also you hold the baby in a similar fashion. Yes, this is good for the baby, and avoid unwanted handling and medications. And community education is very, very important. Then keep the marketing away. Don't adulterate this holy bonding. This is also very important thing. Unfortunately, we have to quote this also. Nowadays, see, one thing what we have been observing is, for a tribal mother or for an uneducated mother, there is no need to tell that breastfeeding is very important. Okay, so naturally she will give the breast milk only to the baby. This truth has been known to that uneducated tribal mother. But unfortunately, this truth is not knowing to the educated mother. Okay, although they are knowing, they have got so many doubts and so many misconceptions. Misconceptions, of course, few of the misconceptions are there in the uneducated people, but more dangerous misconceptions are there with the educated people. Okay, this is the biggest problem. And if you look into busy neonatal ward, okay, in any government hospitals or any other hospitals, instead of promoting the breast milk, we find so many infant formula bottles there. And who is responsible for that? Yes, it is a marketing. So marketing should be get everything should not be marketed. Okay, and everything is not a business. Especially breastfeeding is not a business, and marketing should not be there, because this should not be adulterated. This holy process, holy bonding should not be adulterated. And social media impact is there now. Many social media informations available, they misguide the people. Okay, so people, that means people are confused which one we have to take, which we should not take. Okay, so this has to be kept in mind. Remove the misconceptions and encourage the breastfeeding during the illness. Suppose the baby has got illness, a mild fever is there, mild cough is there, some GIT disturbance is there. First thing what the mother will do is she will stop the breastfeeding. Okay, this should not be there. Breastfeeding should be continued in the illness. That's the best milk, and it is the most complete food. Okay, when the baby is having little diarrhea, and there is nothing other which is best than the breast milk. Okay, it's because in the illness also it provides a complete food. Now we come to the last part where, as I told earlier, nowadays grandmother is not a threat, and doctor is a threat, unfortunately. Previously, we used to say that when the baby is going back to the baby from the hospital, grandmother will, or grandmother and grandfather. So that means older people. So they have got their own version, and they will compel the mother to follow their version. Nowadays, they are not the threat. Nowadays, these business people are the main threat. Okay, so we, in the hospital, we have to create this awareness, but unfortunately in the hospital itself we are writing the infant formula meals, although there is a infant baby formula act is also there. Infant formula act is also there. In spite of that, nowadays for this particular money purpose, or we can say business purpose, everybody is promoting this infant formula feeds, which is very, very, very disguising and very unfortunate. One in the one side On the one side we are promoting the breastfeeding week, promoting the breastfeeding through the breastfeeding week. On the other side, we are doing exactly opposite of that, and this is quite unfortunate. So avoid introduction of the top feeding as far as possible. Then don't create a guilty feeling about the breast milk. This is also very important. Now there are few pathological conditions, not pathological conditions. Some of the problems, for example, breast milk jaundice is there, then lactose intolerance is there. So usually, the lactose intolerance is because of the high amount of the lactose in the milk. the baby is not able to digest it because of the immaturity of the GIT. And most of the time, for the 1 or 2 days, we will stop the breast milk also. Any lactose containing food. Similar in the breast milk jaundice also, in order to diagnose the breast milk jaundice, we need to stop the breast milk for 1 or 2 days. And after stopping the breast milk, if the jaundice comes down, it is confirmed that it is breast milk jaundice. Now, in the both the conditions, we should not tell the mother that breast milk is causing this problem. So once you tell this problem, or once you tell this fact that breast milk is responsible, then she develop a guilty feeling. Yes, my baby is suffering because of my breast milk, and now this is a psychological process, and breast milk production will come down. So don't create a guilty feeling about the breast milk in the mother. Then don't give scope for the mother to avoid the breastfeeding. Now, mother and family members also find many causes to avoid the breastfeeding. For example, LSCS. During the LSCS, how she can feed, she is not active, she is not fully conscious, she is there is much pain is there. All these things are there, which is actually avoids the breast milk. Now, as a doctor, we should not tell that. Okay, even during the LSCS and other primaries, etc., we have to encourage. But once you give a little scope there, then they will utilize it, and then it will be a practice. Then they try to avoid the breast milk always. Okay, so don't give any scope for the mother and family members. Now, be careful about the educated mother and learn from a tribal mother. Always, I say, educated mother, she has got so many doubts in her mind, and there is more scope for confusion. And whereas a tribal mother, she don't have any confusion. She knows only one fact, that I have to feed my child, and there is no confusion, and she effectively feed the baby. So we need to learn from them. Okay, remove the misconceptions and encourage the breastfeeding. So these are all the sustainable methods these are all the methods to produce a sustainable channels for the breastfeeding. I hope I covered many things, and I also completed the given time. Thank you again for giving me this opportunity, Dr. Nagaraj, Dr. Abhishek, and all the faculty members of the college, and also the NEMA president and other members. Thank you very much.
Thank you, sir. Srinidhi, sir. Wonderful session.
Respected Dr. Srinidhi Kumar Acharya, on behalf of organization, I would like to express our heartfelt appreciation to our truly exceptional and comprehensive keynote address on the topic of breastfeeding. Your presentation was not only informative but also deeply moving and thought-provoking. You masterfully expanded our understanding of breastfeeding beyond its traditional scope, emphasizing its profound benefits not just to the baby, for the mother, and but also for the father and the entire family unit. The way you articulated the role of father in supporting this journey and the bond it helps to create a particularly insightful and a crucial message that needs to be heard more widely. Your focus on creating sustainable system to support breastfeeding mothers was a key takeaway for all of us. You rightly pointed out that individual decisions are heavily influenced by the environment we create, and your recommendations for building supportive communities, workplace, and healthcare system. It provides a clear roadmap for positive change. The depth of your knowledge combined with your passion for a vital topic was truly inspiring. You have given us a renewed sense of purpose and a wealth of actionable ideas to advocate for the support breastfeeding in our respective fields. Thank you once again for sharing your invaluable wisdom and for your unwavering commitment to the health and well-being of the families. Thank you, sir. Now, next move forward to our next speaker and session one. It is my pleasure to introduce the next speaker, a leader and a driving force behind this entire event. Her dedication and hard work as our organizing chairperson have been instrumental in bringing us all together for this important discussion. She is now going to guide us through a topic that is crucial for building a more informed and supportive community around breastfeeding. We have heard about benefits, but it is just important to address the common questions and concerns that parents may have and families have. Please join me extending a warm virtual welcome to our esteemed organizing chairperson, Dr. Priyanka Kiran Bairagi, as she takes the virtual podium for her session, Insights into Myths, Conception, and FAQs. I would like to state few points about Dr. Priyanka Bairagi. Dr. Priyanka Bairagi currently works as an assistant professor in Ashwini Ayurvedic Medical College and Hospital, Tumkur. She has completed her undergraduation from Sri Saptashrungi Ayurvedic Mahavidyalaya and Hospital, Nashik, in the year 2019. She pursued post-graduation in Department of Kamara Britya from Keher Shri BMK Ayurvedic Mahavidyalaya, Belagavi in year 2023. She was trained for excellence in the field and talents in the Department of Pediatrics and Neonatology at KLE Centenary Hospital, Yellore, Belagavi. She is committed, centered, and enthusiastic about kids for improvised backgrounds. Dr. Priyanka Bairagi is expertise in working with children with special needs like developmental delay, speech impairment, learning disability, mental retardation, autism, ADHD, etc. The art and technique of pediatric panchakarma is one such area she has specialized in. She also has clinical and scientific experience in working the various stages in monthly development of fetus during pregnancy. By using various Ayurvedic strategies to get healthy progeny and to avoid all the consequences which harm the future of the healthy baby. She is an authorized newborn resuscitation provider by the Indian Academy of Pediatrics and National Neonatology Forum. Trained almost 600 medical professionals in the art of newborn resuscitation. She assisted about 260 newborns in regaining their physiological transition following delivery by receiving, reviving, and handling them. She is the member of National PG Students Coordinator of Central Committee, Pediatric Society of India, NEMA. She is the founder of Ayur Studio and co-founder of Kashyapa Jivaka Tradition. She also spearheaded the Swarna Prashana, Swastha Prashana campaign, which was so far delivered 21,482 doses of the Swarna Prashana to children. She also works on Ayurvedic research projects. She is credited with over 6 articles published in national, international, peer-reviewed journals. She published a manual, Anvikshki, on article writing and publication skills. She is a charismatic, reputable trainer with years of experience imparting educational assistance for students at all levels. Since 2024, she has been consulted as an Ayurvedic pediatrician at Ashwini Ayurvedic Medical College, Hospital and Research Center, Tumkur, actively participating in clinical and patient care activities. Thank you, Dr. Beragi. We eagerly await your insights on the virtual floor. The podium is yours. Please wait a second, ma'am. Sorry to interrupt. Your audio is not audible. Please try once again, ma'am. It is not clear, ma'am.
Is it audible now?
Yes, ma'am, but video is not visible.
Video on करो. Is it okay now? Is it audible?
Yes, ma'am, it is audible, but video is not showing. Yes, ma'am. You're
Okay.
perfect to go, ma'am. You can proceed.
Okay. First of all, I would like to thank you, Dr. Shrindi Kumar Acharya sir. It was a very great session. I think no one can explain this topic very well as compared to any other person. So thank you so much, Shrindi Kumar Acharya sir. Now, I would like to present my topic.
इसमें zoom कहाँ पे?
इसमें जो ये इधर है। हाँ, is it?
On इसमें नहीं sir.
Is it visible?
No, ma'am.
Video on करो.
So, today's my topic is an insight into the myths and misconception and the most common concerns of the mother related to the breastfeeding. If we see most of the most, if we see most of the females are suffering from difficulty in breastfeeding, or they have most of the concerns regarding the breastfeeding. Um, so we are going to discuss about these questions related to the breastfeeding, and we want to help the mothers also and the families also and all the health workers to know how to do the breastfeeding and how to guide the mother to do the effective breastfeeding, exclusive breastfeeding. So here we go. So if we see what is the good attachment or how to start the breastfeeding to the mother, when we start the breastfeeding to the mother, breastfeeding to the baby, first thing we should remember that position of the baby and position of the mother. Mother should always take support to the back and support to her legs. She should hold her baby, she should give the support to the baby's head, back, and the hip, and hold the baby in a comfortable position. She can use the pillow below the baby. And remember one thing, we should touch the baby's tummy and mother's tummy skin to skin, so that skin to skin contact should be maintained. First thing we have to do is we should establish routing reflex. How we can establish routing reflex? We should not insert the nipple of the mother inside the mouth of the baby directly. So what we have to do? We have to touch the nipple to the upper lip of the baby, and we can bring the nipple near to the nose of the baby, so that routing reflex will be formed, and baby will automatically open his mouth. So we can insert the nipple inside the baby's mouth. After that, we have to take care that a baby should hold the whole nipple. Along with the nipple, he should cover the most of the part of the areola. Why it is like that? If we see the anatomy of the breast, so production and ejaculation of the breast milk is happen in the lobes and lobules of the mammary gland. It will go through mammary duct. Then from mammary duct, it will go through lactiniferous sinuses, and from lactiniferous sinuses, it will come out through the lactiniferous duct. So these lactiniferous sinus are present below the areola of that covering the areola, the milk will not come out. So it is mandatory to cover the areola of the to cover the areola of the breast. Next thing, what we have to see the lower lip of the baby. So it should be turned outward, and mother should not feel any discomfort or pain, because if baby is holding on the nipple, mother will feel that pain. If baby is holding the areola and nipple, baby will if the baby is holding areola and nipple, baby will feel mother will not feel the discomfort. So this is the example how we should hold the baby, how we can consider it as a good attachment. So coming to the next part, how to delige the baby. Why we are going to discuss this point? Because most of the time, if the baby feed satisfactory, he will release the nipple automatically. But if baby is sucking and not sleep, so we should not pull the baby from the nipple, because it will be hurting to the mother. So what we have to do? Similarly, we have to establish the rooting reflex. Because of rooting reflex, how we establish the rooting reflex? We just hold the baby and touch the your finger to the near the nipple or on the chin, so that baby will open his baby will open his mouth, and then you can delige the baby. Mother will not suffer from any pain or discomfort. So frequency, most of the primary or the mother who don't know how frequently breastfeeding should be given. So if we see in the starting phase, the mother is priming or the first child is there, so she is not knowing that how to breastfeed the baby, how many times it should be given. If the baby is sleeping, she will let her sleep. So it should not be happen. If we see the frequency, most of the babies will feel hungry every 2 to 3 hours. So we can wait till 2 to 3 hours, then we can do the feeding. Most of the doctors will suggest that in first week of the after delivery, during the first week, we have to do clockwise feeding. Why they are telling like that? Because mother is not trained, baby is not not trained to the latching. He feels difficulty during the latching. So what what doctors suggest that we have to feed the baby in 2 hours. Uh, After establishment of the breastfeeding properly, we can shift it into the clockwise feeding. One more point is that most of the people, what they will do, they will breastfeed before breastfeeding. They will take the weight of the baby, then they will breastfeed. Then after feeding, they will take the weight. It's called what is it called as weighing time. So we should avoid this. It is not going to give us some any kind of information. So baby should be fed on demand, and day and night also. So during night time, babies are feeding. Baby feeds required in initial times up to 4 to 6 times in the night time. So we have to see the frequency. It should be feed every 2 to 3 hours, and the gap between two feeding should not be exceed 4 hours. So duration. See, we you know the difference between fore milk and hind milk. There are two types of milks. In the starting, the milk is secreted, which is called as fore milk, which is rich in protein and lactose, which satisfies the thirst of the baby. And the hind milk is rich in fat, which satisfies the hunger of the baby. But baby needs both the milk. First is fore milk also and hind milk also. So if we want to give the fore milk also and hind milk also, what we should do? We have to give the feeding to the baby both fore milk and hind milk. How will you give? if we started the breastfeeding from left side, we have to empty the left side breast. Then only we should shift the baby to the right side. If you started the breastfeeding before emptying the breast from the left side, baby gets satisfied and gets sleep. So what you will do in the next session after 2 hours, 3 hours, whatever it may be, after 2 hours, 3 hours, you should empty that left breast first, and then you should shift to the right side. So baby will get both fore milk and hind milk. Hind milk is responsible for the fat content. So it is for weight gaining purpose. Hind milk is very important, and for satisfying the thirst for the protein content, fore milk is very important. So this was about the duration, and if we see the breastfeeding process is not the passive process. It should not be look like I am feeding the baby on one side, I am holding the mobile, or I am seeing the TV, I am not looking at the baby. What happens if we do like this? The breast milk will go to the nose of the baby, and it will feel the discomfort, and maybe there is a possibility of aspiration if the baby is sleeping and that breast milk will go to the ear. uh, there is a possibility baby will develop the otitis media also. There will be aspiration also. So we should take care of this process, and already Srinidhi Kumar Acharya sir discussed about the lactation, physiology of lactation. So for breastfeeding, our pituitary system is responsible. Oxytocin, prolactin levels are responsible. Bonding of mother and baby is also responsible. So we have to take care of that oxytocin prolactin mechanism for establishment of the breast milk. uh, we have to do this process actively. How we should convert this process into active process? So it is not difficult. We have to take the baby during the feeding. We should touch the hands of the baby. We can touch the legs of the baby. We can see to the baby. We can actively participate in this process, so that baby will feel that warmth of the mother. Baby will feel the mother's heartbeat, and he will not get sleep. So he will properly take the breastfeeding, and he will get satisfied. So breastfeeding should be always the active process. So how long we should give the breastfeeding? If we see, breastfeeding is a complete food. During first 6 months, there is no. Am I audible? If uh, breastfeeding is a complete food. If we are giving the breastfeeding to the baby in during first 6 months, there is no need to give the water. There is no need to give the honey to the baby or any other food to the baby. Breastfeeding is sufficient. It is not required that baby is born, you should give the multivitamin, we should give this protein and all. It is not required. Only thing what we have to give is exclusive breastfeeding. Single breastfeeding breast milk is also contain all the kind of vitamins except vitamin D. So for the vitamin D, you can hold the baby under the sunlight, or you can give the supplement. It is your choice. So apart from vitamin D, there is no need of any multivitamins or any water to give the baby. Up to 6 months, we have to give the breastfeeding only, exclusively breastfeeding, without water, without anything. After 6 months, we can add some semi-solid food, or some other liquid fruit juices and all. So we have to continue our breastfeeding till 1 to 2 years. But before 6 months we should not stop the breastfeeding. Okay, so this is about the breastfeeding time period. So most of the mother think that if I'm giving the breastfeeding only, it will not become the, it will not satisfy my baby, it will not give all the nutrition to the baby. So to satisfy my baby, to complete his need, I have to give the bottle feeding. So what happens if we compare the nipple of the mother and the tint of that breastfeeding bottle, yeah, breast milk bottle, there is a difference in the there is difference in the structure of that bottle nipple and the original human nipple. So if we consider this is a nipple, if baby want to breastfeeding, what he has to do, he has to do proper latching, he has to coordinated movement between the lips, gums and tongue. He should coordinate his respiration also, he should coordinate his breathing also, and coordinated swallowing also. So for breastfeeding he should require considerable effort. So after some point he will get tired, and so it is some of the effortful mechanism. So baby require efforts to do the breastfeeding from the mother. If we give the bottle to the baby, what will happen? If we see the bottle, there is a one hole at the side of nipple. If the baby just bite that nipple, he will get the milk. So there is no need of efforts. There is no need of any considerable efforts, coordination, and all. So baby will get milk easily. So it is a human tendency. If we get ready-made food, we will not go bring some vegetables and grocery, and we will make the food, and then we will eat, and then after eating we will wash the vessels. So it will be difficult process. So what we will should, we will prefer ready-made food instead of preparing food. Similarly, baby in this case, baby will get confused between the bottle feeding and mother's breast milk, yeah, mother's nipple. So if we started bottle feeding, he will get shifted to the bottle feeding. After giving bottle feeding, if we give breastfeeding, he will deny that breastfeeding. He will prefer the bottle feeding because uh, he does not require any efforts to do that bottle feeding. So whenever after giving bottle feeding, if we start giving his breastfeeding, he will not going to suck that nipple, he will just bite the nipple. So mother will suffering from cracked nipple, yeah, nipple pain. So baby will get confused between the nipple of the mother and nipple of that bottle. So we should always stick on the breastfeeding only. If you see, if you are facing difficulty in breastfeeding, mother is sick, mother is not able to do the breastfeeding, what we have to do is we should express the breast milk in some palade or in spoon, and we have to give that milk to the baby with the help of palade or that spoon. But we should avoid the bottle feeding. Okay, I guess you understand this difference between the bottle feeding and breastfeeding. So how will you consider that my baby get enough milk? So for them, if baby is playing happily, he is not irritable, he is when you are feeding from right breast, there will be drip milk from the left breast. So drip milk is present, babies properly wipe the urine 6 to 8 times. Stool is normal. Satisfactory weight gain. If so, we can consider it as a enough milk. So, what is satisfactory weight gain? If considered at the time of birth, baby's weight was 3 kg. So first 2 to 3 days, baby's weight will in first 2 to 3 days or in first week of the life, baby's weight will be in decreasing stage. Up to 7 to 8% weight of that baby will decrease on the day of seventh after birth. If you consider baby is born today, after seventh day, on seventh day, baby should regain his weight, birth weight. So at the time of birth, baby's weight, if the baby's weight is 3 kg, on the seventh day it should be 3 kg. After seventh day, baby's weight should be increased 30 gram per day. So if up to 4 week, so from seventh day to fourth week, baby's weight should be increased 30 gram per day. If it is going properly, then we can call it as a satisfactory weight gain. So this is an indication of baby is getting enough milk. Okay. So then stool frequency. So if your baby is passing 4 to 6 golden yellow sticky stool, then it can be considered as a normal. But if you see, maybe if you are giving cow's milk, um, or formula feed babies will suffer from the constipation. If you, so there will be some differences in the frequency. If you are giving the cow's milk, you should mix the water in the cow's milk. uh, Obviously, preference should be breast milk only. If breast milk is not available, you can go to the breast milk banking and collect the milk from that bank. If it is also not available, there is, if you have, there is no, if you don't have any option, if you want to give animal milk, we should add 1:3 quantity, 1:3 uh, part of water. If you are getting, if you have 1 part of milk, you should add 3 part of water in that milk, and you can give the animal milk to the baby. If baby is suffering from the constipation because of this milk, you should give some sugar or some saline, glucose water to the baby, so that he will come out of that situation. So, and most of the formula feed babies or cow's milk baby will suffer from the infective bacteria. So we should prioritize breastfeeding only. If we don't have any option, you can give the animal milk also. So sick baby. If the baby is sick, what should we do? uh, in if baby is sick, it is not, it does not mean we should not give the breast milk. We have to give the breast milk. But if baby is sick, baby is not able to suck the breast milk, what we have to do, we have to take the express the breast milk, and we can give with the palade or spoon. If baby is not able to take the milk from palade or spoon, we can use the nasogastric tube or orogastric tube, insert that tube, and we can feed the baby through that tube. Okay. What if the mother is ill? If the mother is suffering from any respiratory illness, there is no chances of transferring infection through the breast milk, but it can be transferred from the droplet and from droplet or saliva. There may be chances. So if the mother produces usually mother produces antibodies in the infective organism, um, and these antibodies cross through the breast milk and protect her baby. But when mother is suffering from cancer or AIDS, that effect of that medicine we should avoid. So in the case of cancer uh, and AIDS, if the mother is taking anti-cancer medicine or anti-AIDS medicines, she should avoid the breastfeeding. She can give the bottle feeding to the baby. If the mother is suffering from the jaundice, she can feed her baby with a strict as a precaution. But what medicine we should avoid during the breastfeeding? So, most commonly, medicine, if we see, anti-cancer drugs, anti-thyroid drugs, anticoagulants, and certain antidepressant drugs. We should not give. In this condition, breastfeeding is contraindicated, and the mother should not eat more spicy food or more laxatives, because can be impact. It can because of these medicines, because of these high spices, baby will get suffered. So twins, um, if we see the twins, it will be very difficult for mother to handle both newborn at one time. So she will need your support, family support. She will need her husband support. Her environment should be stressful. She should require encouragement. She will require assistance from the family member. So we have to take care of her caloric requirement, her nutritional requirement, because she has to feed both of the baby. It is not like mother of twins has insufficient breast milk, or it contains less amount of nutrition. It is not like that. Mother's milk is a baby specific. Obviously, if she gives birth to babies, twins babies, she has capacity to um, produce the sufficient amount of breast milk for the babies. But if she is suffering some difficulty, we can give the formula feed. We can adopt some formula feed to the baby. But it is not like mother cannot feed two babies at a time. She can feed that babies alternatively. She has that potency to fulfill the need of that child. But if she is suffering from any nutritional deficiency, if she is not able to give that sufficient amount of milk to the baby because of her health condition, yeah, because of her illness, so she can give a formula feed. Okay. So most of the time, mother will think that I'm not able to give the sufficient amount of breastfeeding to the mother, breastfeeding to the baby. But it is not like that. Breastfeeding is depend on your psychological condition. If the mother and baby bonding is very good, if we are maintaining the skin to skin contact, if emotional attachment is establishing properly. So, in the case of cesarean born baby, also mother can feed properly to her baby. In the case of emergency cesarean section, when the mother is critically sick and if baby is not able to take her breast milk, then we can use the Balade or spoon. But it is not like that. A mother is having cesarean section, so uh, she can give the breastfeeding to the baby. Uh, if we see the smell of amniotic fluid and the smell of the nipple, it is same. So that's why there is a practice that after birth, if baby is delivered from mother's abdomen, if baby is delivered, we have to keep the baby on the mother's abdomen immediately after birth. We have to see if there is any secretion from the nose or mouth. We have to clean it, and we have to clean the baby from head to toe and cover the baby with one cloth and baby and mother with another cloth. Then, after shifting the baby on mother's abdomen, what happened? Um, the smell of the amniotic fluid will somehow remain on the hands of that baby. So, with that smell, baby will recline towards the breast of the mother, and there is a establishment of the sucking movement, sucking reflex, rooting reflex. Baby will find the nipple. So this is the condition. Like most of the time gynecologists suggest that don't clean your breast uh, af- after delivery immediately, and most of the female think that I should maintain the hygiene, I should clean my nipple properly all the time before feeding. It is not like that. Normally daily bath is sufficient, maintaining personal hygiene is sufficient. If we see before antenatal period, there is a keratin plug inside the nipple so that it will block the entry of any foreign particle. If we see the size of normal spores of your skin and the pores of your nipple, there is a difference in the size of that pores. So as compared to the normal skin pores, size of nipple pores are big. And mammary gland is a modification of sebaceous gland. It will secrete uh, some amount of oil to maintain the hydration and lubricate the nipple. So if we are using uh, repeatedly, uh, if we are repeatedly washing the nipple before feed, it will create dehydration, it will create dryness to the nipple, and it will convert it into the cracked nipple, dryness to the nipple, and mother will unnecessary mother will suffer from it. So we should not clean the breast of the mother in every before every feeding. A daily bath and personal hygiene is sufficient. So mother should wear nursing pad to prevent ugly patches on her clothes, because if the breastfeeding is established properly, there is a chances of drip milk from another side. So to prevent it, mother can use the nursing pad, but she should not wear it for long time, because of that continuous motion there will maybe the chance of the rashes. So she has to maintain the personal hygiene, but it is not required repeated wash and all. Okay. So 2 hours by clock. We have already discussed this topic that 2 hours by clock is only for the primaries, or if the mother is not able to give the milk properly, if she is not able to understand if the baby is hungry or not. In the starting phase, we used to tell that we should do the breastfeeding 2 hours, because for the establishment of the breastfeeding, proper breastfeeding, to establishment of the milk, we should tell the mother that you should give the 2 hours by clock. What happened most of the time, if mother give the breastfeeding to the baby, and baby will sleep. If baby is sleeping, she will not go and see if he want to milk or he want to drink the milk or not. After 4 hours, after 5 hours, after 6 hours, she let her sleep. So it should not be happen, because in first few days there may be chances of dehydration, there may be chances of breast milk loss, there may be chances of fever to the baby. So we should maintain the hydration, we should maintain the glucose level of the baby. And naturally in the starting 2 to 3 days, there is a lactation of breast milk. So to avoid this dehydration, then hypoglycemia, and the excessive hunger of the baby, we should give the breastfeeding properly to semi-clockwise, in semi-clockwise manner, or semi-demand feed we have to give. If the baby, if the, after 2 to 3 hours, if baby is waking up, he is demanding food, he is demanding breast milk, then it is okay. But in there should the gap between two breastfeeding should not be more than 4 hours. We should maintain the gap between two feeding less than 4 hours. This is the thing we have to maintain. So after 1 week, we can shift as a demand feed. Whenever the baby is hungry, we can give the breast milk. But in starting phase, we should train the mother how to identify your baby is hungry. How to identify your baby is hungry? If the baby is hungry, he will touch his face. Baby will act like he is sucking. So you will get to know baby is hungry, and you can give the feed the baby. Mother is small. If there is a concept that most of the female think that my breast size is small, so maybe I am not able to give my baby some sufficient amount of breast milk. If we see the anatomy of breast, the mammary glands are situated inside the situated or embedded between the adipose tissue and Cooper's ligament. So the shape and size is mainly because of the Cooper's ligament and adipose tissues of the breast, and this adipose amount of adipose tissue and the shape and size is also possibility is there. It may be because of hereditary also. It is depend on your nutrition also. There are different factors, but the production and secretion of breast milk is mainly related to the mammary gland. So irrespective of the size of the breast, every woman is endowed with enough glandular tissue to effectively breastfeed her baby. So, if the breast milk is breast milk production and secretion is uh, going on in the lobules and lobes of the mammary gland, there is no role of size and shape of the breast. So it is not like that. If the small breast will produce little amount of the breast milk, it is not like that. Even though if the size of the breast is small, that mother can use sufficient amount of the breast milk to the her mother. uh, Most of the mother give the baby to the bottle feed, and if we see the bottle feed baby and the mother's milk, the baby who is getting mother's milk, if we compare the size and shape, yeah, and weight of the baby, you will see the difference. The baby who is getting formula feed or bottle feed, he is usually chubby as compared to the mother milk, as compared to the baby who is on the breastfeeding. But chubby is not a healthy thing. Formula fed babies gain weight faster and look chubby, but they are unhealthy, and they are at a higher risk of obesity, diabetes mellitus, coronary artery disease. So we should avoid that formula feed and bottle feed. We have to give the breast milk only to the babies. Second baby, most of the mother think that my during my first pregnancy, during my first child, I don't get enough amount of breast milk, so I think is on this time also I'm not able to feed my baby properly, so I will go for formula fed. So it is not like that. Again, it is depend on the bonding of the baby and mother, thinking procedure of the mother, how mother establish the bonding, how mother is taking efforts to breastfeed her baby. So it is not like that if previous time she is not lacting properly, on this time also she is she will not able to feed her baby. It is not like she can feed her baby properly. She can produce enough amount of breast milk. She can give enough amount of breast milk to her baby if she decided, if she take the decision, if she take the initiative, if she takes some efforts to give the breastfeeding to the to the baby. She should, if she if she is suffering from these thoughts, she can discuss with her pediatrician or discuss with her gynecologist. They can guide her properly how to latch the baby, how to hold the baby, what measures she should follow. uh, so this is all about the second baby. Excessive crying. uh, excessive crying is not the indication that your baby is hungry. That crying is see a baby, baby baby is just born. That baby does not know how to speak, how to express her feeling. He don't know how to tell that I am feeling pain, I am uncomfortable, I have passed the urine, I am feeling wet. he is not able to do all that thing. So what he will do, if she is suffering from any type of condition, he will just cry. So whenever baby is crying, we should not come to the come to that point. Maybe baby is hungry, so baby is crying, we have to give the breastfeeding. No, it is not like that. We have to find the reason behind it. The reason, maybe it is due to discomfort, wet nappies, colic pain, overclothing. Maybe he is he is suffering from any pain or rashes. So we have to find the reason behind the excessive crying, and then only we have to search for the solution. It is not like baby is crying, we have to give the breastfeeding. No, it should not be done. So most of the female think that um, my if I give the breastfeeding to my baby, my shape and size, or my figure will be get um, get unattractive. So if during pregnancy, a mother's body is preparing for breastfeeding, so breasts are prepared for lactation and are likely to sag unless the strong support is provided. Excessive weight gain during the pregnancy is also the one of the reason for sagging of the breast. So we should not blame the breastfeeding, because it is tendency. If we are gaining weight, obviously there will be, because of it there will be sagginess. But after the delivery, after the breastfeeding, you are going to regain your pre-pregnancy body. You are going to regain your pre-pregnancy body, because of there is some hormonal secretion. If you are giving the breastfeeding to the baby, there is a burning of the calories, there will be weight loss, there will be utilization of the stored fat. So you are going to regain your pre-pregnancy body weight. So you should not blame the breastfeeding itself as a reason for unattractive breast. It is a part of your pregnancy. Your body is preparing for lactation. So there is a chances of sagginess to your breast. You should not blame the breastfeeding itself as a reason that sagginess. If you are if you have if you have experienced that your first baby was suffering from the breast milk jaundice, it is not like that your second baby is also going. Yes, there is some chances, but it is not like yes, in the previous pregnancy your first baby was suffering from the breast milk jaundice, then in this time also your second baby is also going to suffer from this breast milk jaundice. So there are some chances, but you should not stop completely the breastfeeding. You can decrease the amount of breastfeeding for 2 to 3 days. It will get cured by itself. So you should not completely stop your breastfeeding in the case of breast milk jaundice in your previous pregnancy. Pregnant mother, if the mother is pregnant, it is very important to maintain the gap between two pregnancies. We should maintain the gap of 2 to 3 years in between two pregnancy, because body needs some time to regain its pre-pregnancy body weight, yeah, pre-pregnancy health. So body will need some time to heal. If the mother is pregnant, um, if the mother is pregnant and on the other hand she is feeding also to her other baby, so there is a chances that prolonged breastfeeding by the pregnant woman may be adversely affect the nutritional status of the infant, which may be adversely affect the growth of the fetus. So what we can do, um, we can reduce the period of exclusive breastfeeding of the baby. If the that if after 4 months, uh, we can start in this scenario. The weaning can be started at the 4th month of the age instead of the conventional recommendation at the 6th month, because we have to take care of the baby who is already delivered and who is on the breastfeeding, and the other baby who is inside the uterus. So the should be mother's nutrition have different activities. Mother's nutrition should be that much sufficient that mother's nutrition should complete the need of that fetus also, the need of that breastfeeding baby also, and the need and nutritional requirement of that mother also. So it will be difficult to give the sufficient of amount of nutrition to the infant, and well as the breastfeeding baby. So we can reduce the recommended time period, that is 6 month up to 4 month. From 4 month uh, we can shift that baby from we can give the baby breast milk along with semi solid food. First tooth in the cases, it is not like that. If the teething is start, we have to stop the breastfeeding. No, it is not the indicator to stop the breastfeeding. Up to 6 months, you have to give the breastfeeding properly, exclusively breastfeeding, without any water or any other food. After 6 to 7 month, 8 month, most of the time, most probably 8 month, baby will start teething. You can control your baby. You can tell him that don't bite. Yeah, you can train him. Don't bite. Drink the milk. But up to 6 months, you should give the breastfeeding only. After 6 months, up to 1 to 2 years, you can continue the breastfeeding along with the semi-solid fluid, and then you can shift to the complete food. But for first toothing and starting of the toothing is not the indicator to stop the breastfeeding. Uh, Most of the females think that if I exercise, it will be impactful for my breast milk. So if we see the evidences which are present online, there is no evidence to suggest that exercise leads to soaring of the milk unless the exercise is indulging to the point of exhaustion. So yoga, aerobic exercise are recommended for the mother. He will This exercises will give the strength of the mother. This exercise will take care of mother, that she should be active. Because of exercise, mother will be more active. um, Mother will gain some strength. So mother should be advised to wear firm sport bra and do the exercise immediately after having given the feed to the baby. There is no contraindication for the exercise. So these are the most common questions most of the parents will suffer from. Most of the mothers have concerns about all these questions. I guess most of the questions we have covered. If you have any queries, you can text it in the message box. We will give you the answers. So I guess it is sufficient, and we will discuss about your query in the next time. Yeah. So over to you, Dr. Umair. Thank you so much, all of you, for listening me.
कैमरा रोटेट कर, तुम दिख रहे। Actually, you are visible. Ah, yes. Good to go.
Now time for putting up doubts. I request delegates,
आवाज नहीं
students to ask ma'am doubts regarding the topic. Please drop your questions in the comment box.
आवाज नहीं आ रहा है.
Okay. As we can see, there are few questions for ma'am. First question is from जल्दी इसको चार्ज नहीं करा तो बंद कर दो। अरे चार्जर इधर है। वीडियो बंद कर दो। Ma'am, there is a doubt for you from Dr. Sambata. Now, the doubt is, till what age exclusive breastfeeding should be given and till what age breastfeeding should be continued? May I repeat, ma'am?
Up to 6 months, we have to continue exclusive breastfeeding. After 6 months, along with the breastfeeding, you can give semi-solid food or fruits, smash of the fruits, and it can be continue up to the 1 to 2 years. There is a one concept that even after giving birth to the next child, in the recent um, era, we have seen that mothers are giving breastfeeding to the baby, even though if baby is of 4th year age, 5-year age, 6-year age. So if we see the benefits of the breast milk, it can be continue after 2 years also, but the recommendation is up to 1 to 2 years. If you want um, more, if you want more benefits, if you want to continue the breastfeeding after 2 years also, you can continue the breastfeeding also.
Thank you, ma'am, for your explanation. I hope the doubt of Dr. Sambata is cleared now. And there is one more question from Dr. Arohi. What to do if the breast milk production is more even after 6 months? I repeat, what to do if the breast milk production is even more after 6 months?
Can you repeat the question?
Ma'am, what to do if the breast milk production is even more after 6 months?
You should not stop the breastfeeding after 6 months, but you can do the breastfeeding along with semi-solid food. So it is good if breastfeeding, breast milk secretion is increased after 6 months. It is good. It is beneficial for the baby.
Baragi, for the truly illuminating session. Your presentation on myths, misconception, and FAQs surrounding breastfeeding was not only thorough, but also incredibly timely and necessary. You tackled some of the most persistent and damaging misinformation head on, providing clarity, confidence, where there is often confusion and doubt. So, we often hear about the why of breastfeeding, but your talk was equally addressed to how. By debunking common myths and providing evidence based answers to frequently asked questions, you have empowered our audience with knowledge to make informed decisions and support to their journey. Your ability to present complex information in such accessible and engaging way is a testament to your passion. Thank you for invaluable insights and for helping us create a more informed and supportive community for all of the parents.
Thank you, Umesh.
Thank you, ma'am. Now, I think we all agree that our brains are now overflowing with invaluable knowledge. We have learned about the immense benefits of breastfeeding for the entire family, the importance of sustainable systems, and how to bust common myths and misconceptions. But a wise person once said, "You can't pour from an empty cup," and that applies to both knowledge and our stomachs. So, before we tackle the rest of today's session, let's take a well-deserved breaks. The virtual doors are now open for lunch. Please take this time to relax, recharge, and grab some delicious food. We will be back here at 2:30 p.m. to continue our learning journey. Enjoy your break. Thank you. Welcome back, everyone. I hope everyone had a fantastic and a restorative lunch break. We have all had a chance to refuel our bodies, and now it's time to re-engage our minds. Welcome back, everyone. Excited to dive into the rest of 2025. Following this powerful in the field of pediatric health, Medical College. With over 13 in Ayurveda, specializing in pediatrics, her work focuses on a holistic and integrative approach to child health, covering areas like dietetics, pediatric neurology, psychology. Dr. Lakshmi expertise in not only rooted in her extensive academic background, which includes a postgraduate diploma in counseling and a family therapy and a certificate in childhood disability management, but also in her impactful research and numerous publications. She has been honored with the awards such as Gaveshka Ratna for her outstanding thesis and the Best Paper Award at the International Conference on Early Intervention for Children. She is prolific author, having written and co-authored several books on Ayurvedic pediatrics, including a compendium of pediatric formulation in Ayurveda. Dr. Lakshmi has also been a key resource person for a various government and university training programs, sharing her knowledge with a wide audience of healthcare professionals. Vast knowledge with us. Please give a warm welcome to Dr. Lakshmi MK.
Thank you. So, shall I share my screen?
Yes, ma'am, you may.
Okay. So, I'm audible and my screen is visible.
Yes, ma'am.
Yeah. Okay. So, thank you and welcome all to my presentation. So, first of all, I would like to thank the organizers and Dr. Abhishek, and he's actually my friend, and the organizers of the college for giving me a chance to talk to you regarding the topic Ayurveda and traditional system in promoting and supporting lactation. Okay. So I think from the morning we are in the sessions and you have been hearing a lot regarding breastfeeding and lactation and the same about the for the whole week we have been hearing regarding the breastfeeding. Okay, so I will actually what present to you some traditional systems that we are using to support the lactation. Okay, so that is what we are looking into. And the breastfeeding week itself, you have to see that why we are actually what advocating this breastfeeding. What is the need for advocating breastfeeding? Okay, as you all know, the the theme of this year's logo is prioritize breastfeeding, create sustainable support systems. So that support system is very important. So what is the need for that support system? As you all know, human beings are mammalians, isn't it? So mammals. So it is by nature that we have to breastfeed, isn't it? So, while taking the evolution, we have seen that human beings have been lactating. There was no other option. But where it stopped or what happened, why we need to sell it or advocate this breastfeeding week? What is the what actually tended or tempted us to actually start this breastfeeding week that we have to look into. Okay, so that is the main thing that we have to look. Okay, so as you all know, breastfeeding is very important. No, that is madhureva pibet stanya, isn't it? Tathyalam deha vrutthe. And it is also that avyahara belangam ayurarogo vardhade sugam. It helps in the proper growth and development of children. Okay, and also it will actually help to cure the diseases of the children as well as mother. That is Shishu Dhatriyor Anabhatti, isn't it? So that has been explained in Kashipa Samhita years back. And we have been actually practicing only exclusive breastfeeding from long ago. In the history also, we have seen that mothers were practicing exclusive breastfeeding, isn't it? And we are also appointing Dhatri, who used to breastfeed if the mother is not able to feed the baby. But what happened in between? When it stopped, that actually we have to look, isn't it? So this has been explained in the researches that come later. That is, over 8 lakh infant and young children die each year due to not having adequately breastfed. Okay, and also around 1 lakh mothers annually die of ovarian and breast cancer and experience substantial additional morbidity due to suboptimal breastfeeding. So this is the same that we have heard in this shlogam, isn't it? Shishu Dhatriyor Anabhatti. So if we want a healthy mother as well as a healthy child, then actually breastfeeding is very important. Okay, then taking into that evolution, the sequence of evolution also, we can see that breastfeeding is very important because we are all primates, isn't it? And primates have actually a large sized brain, isn't it? So large brain, when we compare us to the, for example, the young one of a cow or a dog and compare it with the human beings, the head is large in human infant, isn't it? So that actually requires close contact and frequent nursing and extended period of postnatal care compared to the other animals. Okay, so we are actually very much developed, but still we are an animal, isn't it? All human beings are animal, and actually they need an extended period of postnatal care. Okay, so human beings are born in exceptionally immature state. Okay, that requires more contact with the mother and actually requires more caregiving. Okay, so that is why breastfeeding is very much important. And also we all know that under 5 deaths are attributable to improper breastfeeding, around 5 lakh of under 5 deaths. Okay, and also it will cause actually diseases in children, and it will hamper the growth and development, and that actually leads to what expense, medical expenses and other expenses that contributes to around 341.3 billion. Okay, so these all shows the important or rationale behind what advocating this breastfeeding week. Okay, my sound is clear and everything is fine, no? Shall I continue?
Yes, ma'am.
Yes, okay, thank you. Taking into a little bit statistics, I will not bore you going into details of the statistics. 47% of infants receive exclusive breastfeeding from the year 2015 to 2021. And actually, as far as NFHS 5 survey is concerned, in India, exclusive breastfeeding has actually improved. Okay, from 54.9% to 63.7%. Okay, then actually urban areas reported exclusive breastfeeding a little bit lower than that of rural areas. Okay, so everything that is what why breastfeeding and whoever is breastfeeding actually depends on the educational status, the awareness about their breastfeeding, and the family members who are with them, the support they get from the families, and their socioeconomic status. Okay, so all these things we have to consider. So now taking into a little bit into the history of the breastfeeding. Actually, I started with saying that we are all animals and we are mammals, and we started with breastfeeding only. Initially, there was when the human beings were nomads, and in the earlier period, no, there was only breastfeeding. Then what happened in between? Actually, that we have to study. That started with this colonization and colonialism and everything. Okay, so what happened is these those who are the colonizers, okay, they consider this breastfeeding as an uncivilized practice. Okay, they thought that this is like that of an animal habit of feeding that their young ones. It is an uncivilized thing. So they actually wanted to reduce the birth spacing and increase their fertility so that they will get more laborers from the colonies. Okay, so they advised them not to breastfeed or breastfeed only for a little time and then stop it, so that they will these ladies will again become pregnant and they will have more laborers from the colony. So that is how they practiced. They stopped this breastfeeding. Okay. Then what happened is gradually, as the years passed by, then came that commercial milk formula companies. Okay. So commercial milk formula companies actually they started to market with aggressive efforts. Okay. Then what happened is they got the support from the medical fraternity, because this delivery and the delivery which was once a natural process later actually became what it was. It became a part of the medical authority, isn't it? Nowadays all deliveries are actually a hospital delivery, isn't it? So it came a consolidation of the medical authority came in combination with their commercial milk formula company. And okay, and they actually what they propagated the use of this commercial milk formula. Okay, so thereby also that breastfeeding actually reduced. Okay, so that is the rise of colonialism and the racial capitalism and the accompanying medicalization. So the term medicalization is very important. That means everything becomes medicalized. Even once it was a normal delivery which happened in any house or anywhere, that becomes actually medicalized. Okay, so definitely we will actually propagate only hospital labor, but still that medicalization along with that what unwanted business techniques in that actually led to the stopping or limited breastfeeding in the history. Okay, then what happens is these products, this commercial milk formula, were aggressively promoted as a solution to address malnutrition. Okay, particularly in African countries by professionals as well as the NGOs. Okay, and this actually helped in the promotion of this commercial milk formulas. Okay, then what happened is they targeted indigenous breastfeeding practices, and they instructed that even though you are breastfeeding, you should give these formulas along with that. So that is actually scheduled feeding with this commercial milk formula. That also actually came in between. Okay. Then what happened is the problem with the mothers. They told the mothers that self-reported insufficient milk. They made the mothers feel that the milk is not sufficient for the child. Okay, and most of the mothers reported that they have insufficient milk. Okay, for example, in the case of a primea and all, when the child is crying, they feel that it is due to that insufficient breast milk. Actually, there are many other reasons. Okay, so and then comes the industrialization. Actually, this commercial milk formula industry is around USD 55 billion industry. Okay, it's a business. So that actually has played a role in reducing this breastfeeding practices. Okay, then actually this another commercial milk formula marketing, they reframed this normal human infant behavior as problematic. That is what I told. If a child is crying, or if the child has a colicky pain, or if the child is not having sufficient sleep, they propagated that it is actually due to this insufficient breast milk and you should start using CMF. Okay, so these were actually the causes for the reduction of breastfeeding in the history. That is why we are actually today sitting here, everyone sitting in the afternoon and discussing regarding breastfeeding, which was once a very normal process. Okay. So then coming into what is being told in our text. So now you came to know what is why we are doing this awareness week and why we are discussing about breastfeeding. What is the importance of the practices to improve their breastfeeding. Okay. So as you all know, from the morning, maybe you are discussing these things. Sorry that I couldn't join because I had OP duty today. So as you all know, the ahara rasa, isn't it? The rasa, the stanyam is the ubadadhu of rasa, isn't it? So from the ahara rasa, with the action of the rasa dhatu agni, actually what happened is the Rasadhatu is formed, and from the Rasadhatu, the Ubadhatu of Stanyam as well as the Rajas or the Rektam is formed, isn't it? So, Rasa Stanyam Tado Rektam Asrujaha Kandarasira. So the Ubadhatu is formed. Then what a subtle Rektadhatu. From the Rasadhatu, then the next Dhatu, that is the Rektadhatu, will be formed. And the waste part is the cup. Okay. So this is the formation of the Rasadhatu. And from that itself, it's clear that definitely, since it is formed from the Rasadhatu, it will be increased by the materials or the dravya which has the same qualities like that of the Rasadhatu. That is, which are Snigdham, Sheedam, Guru, etc. Isn't it? So the dhadus or the dravyas which have the qualities of Rasadhatu, that is, it is almost similar to that of the Kabham also. Okay. So that is Sheedam, Guru, Snigdha, isn't it? These will help to increase the breast milk also, or the stanya. So this has been very clear, I think. From the morning, you may have been discussing about this. Okay. So coming into the practices that will help to improve the breastfeeding. As you all know, the nutrition of mother is very important because, as we have discussed, it is formed from the Ahara Rasa. So the mother should take sufficient quantity of food, and that is actually an additional 600 calories and 13.6 gram of protein are required during the first 6 months of lactation. Okay, and additionally, in the next 6 months, 520 calories and 10.6 gram protein is required. Okay, as you all know, in Ayurveda, it is told that the Bhartra Pratyesha Garbhadrak, that is after Sudhiga, during the Sudhiga Paricharya, and after that, they should be cared with utmost care and utmost protection should be given to that feeding or lactating mother, isn't it? So, that they should be cared with most appropriate. That much effort should be taken to give care and support to the mother, particularly in the aspect of nutrition. Okay, so whatever we see in the OPs nowadays is that the child will complain of flatulence, and when we inquire about the mother's diet habits, they say that they are actually taking less food because they want to take their body shape back. Okay, but actually that is very wrong. You have to take extra calories than you are taking before, even during pregnancy. Okay, so now what are the practices that you should take to encourage breastfeeding in the mother? So definitely it has 3 levels, that is the individual level factors, the group level factors, and the society level factors. Okay, so individually we should actually see what are the problems, whether the child has any health problem or whether the crying, we will see the crying hungry baby in detail, and the sex of the child, that is there may be sexual usually in India, no, male children will be given more care than the female children, girl child, so that should be taken care of. Then then the mother child dyad, that interaction between the mother and the child should be taken care of. Then attributes of the mother, that if the mother has any problems, that is the maternal health problems should be taken care of. If the mother has cracked a nipple or a inverted nipple or any problem with the nutrition, that also should be taken care of. Okay, then comes the features of the environment. Environment is very important because particularly for a priming, as well as if the mother is having a second child, then there should be someone to take care of her first child. Otherwise, she will become tensed, isn't it? So that is also very important. So the health services, the access to health services, the living arrangements, the family, the support, the livelihood, the food security, isn't it? Then any other bad habits in the alcoholism or smoking, etc., that should be taken care of. Then the flexible work environment, that is actually very important because even now in most of the states in India, the maternity leave is actually only 6 months. So after that, we are finding it very difficult to feed the babies, isn't it? So that actually should be taken care of. And that should be addressed. The maternity leave should be at least for about 1 year, isn't it? Then only we can have a good breastfeeding. Then there should public policy environment. All these things should be the marginalization, the slum dwellers. We should also take care of that lower socioeconomic community also. for casual laborers, so for the daily laborers, etc. So that should be taken care of. Okay. Then comes the society, culture, and economy. So chronic poverty and the involvement of the culture and the religious beliefs, etc. So most of the people know they actually avoid the colostrum because they think that it is not good for the health of the baby, and the child will not be able to digest that colostrum. Okay, so that should be taken care of. Okay, then comes the physiological effectors of lactation. So, for example, that if the mother is diabetic or it has obesity, that is adiposity, then energy expenditure, then the food intake of the mother, all these have an action on the breast milk, on the mammary epithelium. Okay. Then the sensitivity to the local and the systemic hormones like insulin, prolactin, oxytocin, adipokines, etc. have an action on the breast milk. These all of you know we have studied in physiology and all, and from the morning you may have been discussing about the production of breast milk by prolactin and its ejection by the help of the oxytocin, isn't it? Then actually there is sensitivity to the local and systemic building blocks. The breast cell, no, the breast epithelium, endothelium has a endothelial cells has an local sensitivity to that building blocks like the lipids, the carbohydrate, the protein, water, minerals, etc. So what is the quality of the breast milk actually depends on the sensitivity to these building blocks. That actually should be taken care of. Okay. Then that is actually the mammary epithelial cell intrinsic responses. Okay. That is the cell-to-cell junction of the mammary cells, the facilitative and the active transport mechanism in the breast cells, the peripheral nutrients that and the substrate that reaches the breast tissues through the blood, the purine derivatives, mitochondria respiration capacity, then what the enzymes, the nutrient transcriptional regulation, etc. So these are all very important. Okay, these actually and also the omic, the multi-omic assessment of that breast tissue is also very important. Okay, how these nutrients from the mother's food reaches the blood, and from the blood how it reaches the breast tissue, and how it is that breast milk is formed with a proper sufficient quality and quantity, that is actually very important. So that also we have to look into. Then, so regarding that practices that you should see for the successful breastfeeding, or the support that we have to give to the mother, as you all know, the baby friendly hospital initiative of the WHO and the UNICEF. Okay, BFHI, the 10 steps to the successful breastfeeding. That is very important to enhance breastfeeding in the mother. Okay, so that is the hospital should have a policy, a written policy, that we will initiate exclusive breastfeeding till 6 months of age, and also advise to continue breastfeeding till 2 years of age. That should be a written policy in the hospital. Then what? Then comes actually the staff competency. Okay, the staff should be sufficiently educated. That is very important, because in the labor room, immediately after delivery, when we are initiating the breastfeeding, the nursing assistant or the nurse who is taking care of should be sufficiently educated to give proper counseling to the mother about the particularly a primary regarding the breastfeeding. So staff competency is very important. Then the antenatal care, definitely to prevent that inverted nipple like conditions, and to advise the mother regarding the breastfeeding. Antenatal care is very important. So counseling during that pregnancy period. It should not be that after delivery you are going and advising the mother who is in a severe pain after delivery, either in a normal delivery or CS, you are going and advocating regarding the breastfeeding. Actually, that is actually really intolerable at that time, isn't it? So we should actually take proper antenatal care and give counseling regarding breastfeeding. Then right after birth, about the proper care, about the initiation of the breastfeeding, that is very important. And support mothers with breastfeeding, their proper diet should be given, then supplements should be properly given, and the most important thing is rooming in. Okay, and responsive feeding and bottles, teats, and pacifiers, etc. are very important. Okay, and after the discharge, a breastfeeding group should be formed, which will help to what give doubts, clear the doubts of the mother. Okay, so the practices that assist the breastfeeding, the main practices is rooming in. Rooming in means the mother and the infant should be kept together 24 hours a day. So that is actually the practice that is Ayurveda. We say that we are saying about a Sudigagara and a Kumaragara. It is not that the child should be kept in in the common place. So the mother and the child, they should be kept in separate rooms after delivery, during that time of delivery in the Sudigagara, and after Sudigothana in the 10th day, they should be transferred to the Kumaragara, isn't it? So that is very important because there they will have caretakers who are properly educated to give counseling regarding breastfeeding or the problems with the child, etc. Okay, and no other persons will enter into that. So that will help to prevent infections as well as give adequate freedom to the mother for breastfeeding, isn't it? So that is rooming in. This was actually very well established in Ayurvedic textbooks, our classics. It is not a new thing that has been educated in Ayurvedic classics even in that long ago. Okay. So feeding in response to baby's cues, that is very important. So whenever you have to identify when the baby is hungry and you have to start feeding, okay, before the baby becomes more hungry. Okay, so the mother become confident in taking care of the baby if they are rooming in if practiced. So these are the things that we have to look at. It promotes bonding between the mother and the baby. Then what? Then the feeding should be actually baby-led feeding or demand feeding. So it should be based on the baby's needs and signs. Okay, so that helps to actually get more immune-rich colostrum and therefore more protection from illness. They will help for faster weight gain and actually that less crying. Okay, so early easy establishment of breastfeeding, etc. Then, so we will see because most of the mothers will have a doubt regarding whether the child is, why the child is crying. Is it due to what? Is it due to hunger or is it due to, just a minute, okay?
Yes, ma'am.
No, I had a video. Okay, we have to see whether the baby is crying due to hunger or not. Here, no, the baby is very much relaxed and is lying in a relaxed manner, and mouth is not open, and the baby is lying freely. So that means the baby is not in hunger. Okay, so then we have to actually see the mouth, the movement of the mouth. So that indicates that the baby is in hunger. Okay, so that movement of the mouth is very important, is opening the mouth. So that means the child is having hunger. Okay. Then actually has they will have a rooting or sucking reflexes. So that also actually indicates that the baby will be in hunger. Okay. Then okay. Then actually the baby will have a rooting reflex, and even when you put the fingers near that, the child will have that rooting reflex, and also the child will be restless. So these are actually the cues for a hungry child. Okay, so that we have to look into and actually give counseling to the mother that this is actually a hunger cue, and you have to start feeding the child. Okay, so that is what we have to educate. Then ways to say, you have to educate the mother the ways to settle a crying baby. So if the baby is crying frequently, actually it should not be only due to hunger. We have to see whether it is due to pain or loneliness or tiredness or any other reasons like wetting of the cloth, etc. So that we have to see and advocate or educate the mother. And also we have to see the ways to wake a sleepy baby. So always the mothers may complain that the baby has not sufficient breast milk, she is not gaining weight, he or she is not gaining weight. So what will we do? The child will be always sleepy. So we have to advise them how to wake a sleepy baby. Okay. So actually remove the blanket and give a gentle massage to the child. then try waking him up in an upright position. So likewise, we have to advise them how to wake a sleepy baby. Okay. Then the third thing is actually, these are actually the steps in the baby-friendly hospital initiative to promote the breastfeeding. Okay. Then avoid unnecessary supplements. So we should not give any other supplements to the child. So we say in Kashapa Samhita also, Sarvam nivaryate bale stanyam tu na nivaryate. You can stop anything to the baby except breastfeeding. Breastfeeding should be continued in any circumstances. No other supplement should be given to the child. Okay. So that actually is very important because exposing these actually lead to allergens and intolerance leading to eczema and asthma. We can see that in our OPD when we take the case, the child who has recurrent respiratory infection or allergic conditions, actually, when we take the history, they have an early introduction of complementary foods. So, or weaning foods. So that actually should be taken care of, and exclusive breastfeeding should be advised till 6 months of age. Okay. So, and it also actually reduces the mother's confidence also. That when mother feels that, oh no, my breast milk is not sufficient, you have to give additional supplement that is necessary. So likewise, actually, they will think like that. And also avoid bottles and teats. Bottles and teats, you know, we see, though in India it was not popular, nowadays it is gaining popularity. Teats and bottles and pacifiers, actually, they actually carry infection. They have many problems. And the actually should be made of good silicon thing. Otherwise, it will also, if it is made from cheap plastics or something like that, no, it can actually cause introduction of microplastics into the body of the baby also. So that should be taken care of. And also ear infections and dental problems are more common with artificial teats and pacifiers. So that also should be taken care of. Okay. And the oral muscle development also is depends on the breastfeeding. And also if you use bottles and teats, it is actually very difficult. Then now coming to some galactogogues or oral pharmacological galactogogues that we use, that is used commonly. If the mother doesn't have the sufficient breast milk, then before going into artificial or commercial milk formulas immediately, actually we have to look for pharmacological galactogogues, isn't it? Commonly used ones are domperidone. They are actually the increases the prolactin release from the pituitary. Then metoclopramide, it increases prolactin levels by anti-dopaminergic effects. So as you all know, the dopamine actually inhibits prolactin. Okay. So that metoclopramide and domperidone actually has an anti-dopaminic action. Okay. And also the oxytocin level will increase only if the dopamine level is less. Okay. So that is also very important. So sulpiride also increases prolactin levels by anti-dopaminergic action. And thyrotropin releasing hormone, this also helps to increase prolactin via stimulation. Okay. Then coming to some common practices that we use to natural oral galactogogues that we use for increasing. These have actually been studied in very detail. These drugs have been practicing as a traditional practice in almost all parts of the world. Okay. So one of the most important drug that has been studied in detail is alfalfa or Medicago sativa. Okay, Medicago sativa. It is actually called as ashwabala. Ashwabala. So the leaf is used and it actually stimulates prolactin. Okay, and it provides actually the nutrients for the milk production. And also anise or aniseed. That is actually mishi or shadapushpa. That actually contains trans anethol, considered weakly estrogenic. It actually has a dopamine receptor antagonistic activity, thereby enhancing the production of prolactin. And banana flower, you know, banana flower, that is also actually has an increased prolactin level. Studies in rats have showed that increases prolactin level. Banana flower, we usually use traditionally, you know, for cooking and everything. So that is also very good. These are already been studied. Then barley or grain, it actually stimulates prolactin, contains polysaccharides that stimulates prolactin. So barley is also very good. Then another one, most important drug that we can use to enhance this breast milk production is chickpeas. that has an estrogenic isoflavones that stimulate prolactin. Then coriander fruits, it has actually, the study shows that it has not that much effect on this breast milk production. But cotton seed, many studies have been done in cotton seeds, and it shows actually stimulated prolactin in animal studies. A lot of studies has been conducted. Okay, and in cumin is also estrogenic. It stimulates mammary growth in rats. Okay, so these have all been studied, and I have given a link of this a good systematic review paper, which actually shows that all the traditional practices that have been studied. Okay, and another most important studied drug is fenugreek. Fenugreek has been traditionally practiced to increase the breast milk, isn't it? So it stimulates the growth hormone in ruminants. It stimulates the milk production through dopamine receptor antagonism. Then phytoestrogens may stimulate this one production of breast milk and ejection of breast milk, etc. So fenugreek, now it is widely used throughout India, all over India, as a food for lactating mother. Okay, then garden cress. Garden cress is also used for milk ejection. Then ginger. Ginger, actually, the action of ginger or Gingiber officinalis is unknown. And Galliga officinalis. Galliga officinalis is lavani. Actually, it also has it's a family of Fabaceae, and it also exerts effects via steroidal saponins. Okay, it enhances the mammary growth. Okay, so these are actually certain drugs that we traditionally used throughout the world, not only in India or not only in Ayurveda like that. It is, and many studies have been conducted throughout the world, and they are using all these drugs. Okay, so as you all know, the Ayurvedic practices that we do to promote lactation, it starts even antenatally with the Garbhini Paricharya, isn't it? So we advise proper Masanumasika Charya with the use of Kshira, Khrida, etc. towards the last trimester, which actually increases the growth of cells, isn't it? The cell organogenesis, etc., happens in the first trimester and all, and towards the last trimester, actually there is increase in the size of the cell, and there we use more Kshira, Khrida, etc., and that actually helps in the production of increased mammary tissues also, and production of breast milk also. Okay, so that is very important. And also the Simando Nayana Samskara, isn't it? That actually happens towards the last trimester, that is after the 7th month of pregnancy. That also actually gives a support to the mother. All the relatives, Vaidya, everyone comes and gives a support to the mother. That psychological factor which helps in the production of oxytocin, etc., will be promoted by that samskaras. Okay. Then the Sudhiga Paricharya, definitely nowadays the postnatal care is having has shown a good hype in common people, and those who are not practicing it for the last 5 years, no, now they are actually doing the Sudhiga Paricharya, and that also helps to increase that production of breast milk. Then definitely the Jada Karma Samskara, in that there is actually initiation of breastfeeding. So in Ayurveda, we have given that much importance to breastfeeding that in the Jada Karma Samskara, it is given so much importance. And also, I told you about the Sudhigagara and Kumaragara, which helps in the rooming in or the mother-baby died out concept. Okay. Then there is also the explanation of Kumara Adhara. Kumara Adhara means the caretakers in that Kumaragara. So they are actually very well educated, or they are having experience, very well experienced caretakers. They know how to give counseling to the mother, how to feed the baby, or how to stop the crying of the baby if it is for another reason, how to understand the cues of the baby. So they are being explained to the mother by that Kumar Adharas. Okay, so these are all very important. They will also know that we know now that is Najak Shudita Shogartha Shranta Pradushtadhadur Garpini Jwarida Adikshinam Adistulam, isn't it? Viruthahara Puttayam Stanyam na paye. So what are the contraindications of breastfeeding, or how to take care of the mother to avoid these situations? Okay, so these are all actually advised by the Kumara Adhara. Okay, so that is also very important. Then this is actually in Kerala. we are having a Sudhiga Parichaya that is being practiced throughout Kerala. In different districts, actually, different practices are there. But these three drugs we use actually in almost all districts. Okay. That is, after the initial stage of delivery, we usually give Tikshna drugs, isn't it? Pipali, Panjagolam, Panjagola Evagu, etc. for that Garbhashaya Shodhanam. And after that Garbhashaya Shodhanam, we actually give, along with that, we will start what Abhyangam, etc. And that Arishta Kalpanas are also given to the mother. And after that 1 or 2 weeks, we actually start giving the mother what we say that kuruk, that is a lehya preparation. Okay, lehya preparation, avaleha preparation that we make with jaggery or palm jaggery. Palm jaggery mainly. Palm jaggery, rice powder, and along with that kalkam of these drugs. So, for example, we mukkutti, you know, the first one, biophytum sensitiva, that is the alambusha or samanga, we say. So, we actually make the samulam. We take the drug and we make it a kalka and we mix it with rice powder and palm jaggery and make an avaleha preparation and give it to the mother as a actually like a snack. For example, 11 a.m. we give to the mother in that much quantity. That is like a snack quantity, say around 100 gram. Like that, we feed the mother. Okay. Then after 3 to 5 days, in some places it is 3 days, some places it is 5 days. After that, the next drug will be taken. That is, for example, the Cisampelus pereira. So that drug will be taken, and instead of that biophytum, we will add Cesampelus. We will make that calcum of that and take that. Okay. Then in the next 3 to 5 days, the next drug will be taken. Okay. That is the Thespesia populnea. Okay. That is Puvarash in Malayalam we say, or the Vadaparna or Bhairava Patra. So that we take, we make that kalka of that, make that avaleha preparation and give it to the Sudhika. So these are all actually traditional practices that we use to enhance the breast milk production. Okay. So maybe in different places, different traditions are there, but this is actually practiced in Kerala. I put only three things. There are many other. Some actually use curry leaf also. Curry leaf, make it into a paste and give it for 3 to 5 days. Okay, then fenugreek we do. Fenugreek, we prepare this lehe kalpana with fenugreek. Then some prepare with kurkuma longa. That is haridra. So likewise, different preparations are there, and only one preparation is not continued. That is the most important thing. One is continued for 3 to 5 days, then it will be shifted to the another avaleha preparation. Okay, so this is the traditional practice that we use to enhance breast milk production. Then in Ayurveda, we can say that it should be that hida ahara viharena itna duvajarechate. Then the psychological factors is being given very important. Shukroda lenghana ayasa sanyanashase hedava. So the mother's psychological status should be preserved. They should be given proper care. Then particularly the drugs that are being used. Tanyasya sidu varjyani madhyani anubaja resa. Kshiram Kshirinya Oshadhyaha Shogadesha Vivedya. So Kshiram and Kshirini Oshadhi are very important. So this is a very good shogam from Kashipa Samhita that you can advise to a mother. So that is Madhurani Annabanani Dravani Levanani, isn't it? So you can advise, actually very good diet for a lactating mother will be like take a portion of the cereal. For example, rice, that is Shali or Shashtika, that will be good. Then what? Then one portion of meat if you are a non-veg, or mudgam if you are a vegetarian, then add into that. Then some leaves, except Siddhartha. Then mamsam when you take, it should be chicken or mutton. Don't use varaham or mahisha mamsam. So add that part also. Then what? Then boil it or cook it in a pressure cooker or something, like in a drava, like a porridge or kanji we say. Make it into a kanji. You can add fenugreek also in that, or medhiga into that. And after that, after cooking that, add some coconut milk. Here we use coconut milk, so add coconut milk. Then after that, what we say, we make a tatka with leshunam and palandu. make a tatka with that curry leaf also and add into that porridge and mix with very well and give it to the mother. That is an ideal food for a breastfeeding mother. Okay, so it contains all the nutrients, carbohydrates, protein, fat, minerals, everything, and also Devana drugs. And if you add green leafy vegetables into that, then it will be very good. And for example, durva or such what the stanya vardhana gana, if you add into that, then it will be very good. Okay, so that is an if you can make a sweet thing that along with the gudam also. Actually, it is said that Pakyam Gudavedam Sakridam Shalimashe Abhi Shushkastanina. Even it can cause milk production in the Shushkastani also. Okay. So this is the practical application of this shloka. This is from the Kashipa Samhita 19th chapter. So this is practically very useful. We usually advise them to the mothers. This you have already know from morning. You may have been hearing about the Sanya Vardhana, Ganas, Virana, Shali, Shashtiga, Ikshuvaniga, Darpa, Kushakasha, Kundra, Kadaga, Trinamule. Actually, this is available in market as Tanya Janana Rasayana. I think the Kotakal Arya Vaidashala is having a what medicine like that, Tanya Janana Rasayana, which contains actually all this what Deshemani, Tanya Janana Deshemani, along with it is an Avaleha formulation. It is in an Avaleha form along with Gudam and Krita. Okay, so this you can advise to the patient. So these are actually the traditional practices that we follow to enhance breastfeeding. So concising everything together, we can actually say that this I took from my paper. It has been very interesting. That is, we have to look into the breast milk quality and quantity. For that, you have to look into the diet and lifestyle, the physical and mental stress, the sleep disorders of the mother, the diseases, and about the type of pregnancy, their culture, poverty, malnutrition, everything you have to look into. Okay. And if you want a community-based intervention, you have to go into that. Then breastfeeding promotion should be done at home or workplace, and public health initiatives should be taken for proven traditional and complementary and alternative medicines. Okay, so public health initiatives should be addressed because we have already many studies have been done and it has been shown that it will actually improve that breast milk production. Okay, and then sensitization and induction to health programs. Okay, to reduce this malnutrition. So all these should come together, and this will actually improve the quality and quantity of the breast milk. Okay, so we have to also look into the Stanya Dushti, the detoxification of the breast milk. That also should be addressed in the public health initiative also. Okay, so I think I have explained almost the practices, the Sudhiga Parichedya, what you have to do, the diet of the Sudhiga that enhances the breast milk, the Galactogogues that you can use to improve that breast milk production, and above all, the psychological state of the mother, because it is reformed from Resagadu. So that is very important. So the practices that you should take, that is the mother-baby rooming in, and about the advices to be given to the mother, about the hungry cues of the child. So all these things we have covered, and I think this will help to prioritize breastfeeding and create a sustainable support system. So with this, I thank you all the organizers for giving me a chance to present my topic. If you have any queries, I'll be pleasure to answer. Thank you.
Thank you, ma'am. Yes, ma'am, there is a doubt from a student.
Yeah.
Ma'am, the question is, are there any possible ways to enhance breastfeeding in first day itself?
In
LACS.
Okay.
After delivery, after delivery, on the first day itself, if the mother is unable to provide sufficient amount of milk, so is there any way to enhance the breastfeeding? Yes, ma'am, please.
Yeah. Okay. So in whether in a CS section or in a normal delivery, definitely particularly in a primary, they will have difficulty in what? Yeah, pardon. Yeah, they will have problems in breastfeeding, isn't it? Particularly in a primary. So that is why we have shown you the importance of antenatal counseling and antenatal what support to the mother for improving the breastfeeding. And actually, even after CS, the most important thing that you should look into is the diet of the mother. Okay, so the diet should be sufficient for the mother to have. I mean, after having from the post-op unit, you have to look in the diet of the mother. Maybe in the first day or like that, they will find it difficult, but still the breastfeeding is not that much problem. It is common in, I think it is the statistics is common in both CS and normal delivery, isn't it? So the diet should be given more important, and the counseling is the most important thing. Counseling for the mother, that should be given actually prior to even CS or normal delivery. So that is very important. Anyway, it takes time, no? By around 2 to 3 days, only the breast milk production will be complete. So you have to advise that in the initial days, the colostrum is sufficient. Colostrum is sufficient for the child. That itself is enough. So that is the thing we have to advise the mother. Hope I have answered.
Yes, ma'am. Thank you for the clarification, ma'am.
Yeah.
And thank you, Dr. Lakshmi, ma'am, for truly enriching the enlightening session. Your talk in Ayurveda and traditional system in promoting support and supporting lactation was a masterclass in connecting our past to present. You took us on a fascinating journey from the evolution of mammals to the history of breastfeeding and gradual deterioration of deterioration of essential cultural practices.
I think there is some network issue there.
Due to the various waste formulas which contributed to the vitamins. Ma'am, am I visible?
Yeah, yeah.
Thank you, ma'am. As I was saying, by detailing how the risk of formula has contributed a cultural dependency on the challenge us to think more critically about the forces that have shaped our breastfeeding culture. Your presentation is a powerful reminder that we need to work more on our practices and improve the current state of minds of the mother. Even the modern days mother working, they do not like much emphasis on baby's care. So thank you very much, ma'am, for your
Okay.
approach to maternal and child wellness.
Yeah. Thank you. Thank you very much. Thank you, the organizers. Thank you all.
Thank you, ma'am. Now to address a topic of immense practical importance, we welcome our next speaker. It is my pleasure to invite Dr. Anusha Rao to the virtual podium for a session on breastfeeding in special circumstances. This is a topic that requires not only expertise but also empathy, as it addresses the unique challenges and needs of mother and babies in situations that fall outside the typical experience. We look forward to hearing her insights and how we can provide necessary support and guidance in the critical moments. Please join me in giving a warm welcome to Dr. Anusha Roy. And there are some few points I would like to mention about Dr. Anusha, ma'am. Dr. Anusha has done PD from KEM Hospital, Mumbai, and in neonatology from KEM Hospital, Pune. Dr. Anusha was honored with prestigious Dr. S. Jayam Gold Medal in Neonatology 2022 in a distinguished ceremony graced by Honorable President of India. National Board Certificate Lactation Consultant ACLP. Dr. Anusha has also published 10 plus scientific papers in prominent national and international pediatric and neonatal neonatology journals. The virtual floor is all yours, ma'am. Please proceed.
Yeah, thank you so much for the introduction. I'll just directly share my screen.
Yes, ma'am.
Yeah. So intermittently, I'll keep asking, am I audible? Just please answer me in between, unmute and answer. And
Yes, ma'am. No problem.
is there a possibility of taking like question and answers in between the session, or I have to like do it in the end? Because I don't see audience here. I think it is being live streamed, right, on YouTube?
Yes, ma'am. It is being live streamed, so it is better to take it in last.
Take it in the end only, no? Okay. Okay.
Yes.
Okay, the screen is visible, right?
Yes, ma'am.
Okay, fine. Just give me a second. There's some noise. Yeah. Voice is clear, no?
Yes, ma'am.
Yeah. Okay. Good afternoon, everyone. I'm Dr. Anusha Rao, consultant neonatologist working at Ankura Hospital, Pune. So today we'll be talking on the topic breastfeeding in special circumstances. So just going ahead with the topic. So can all of you identify this? A very common condition these days. So what is this? Tongue tie and lip tie. Okay, so the challenges when a baby has a tongue tie and lip tie is basically there will be a problem in breastfeeding, mainly because of latching issues. And if the latching is poor, the mother is going to feel a lot of nipple pain, nipple soreness, and there won't be effective milk transfer to the baby. Hence, the baby will be always cranky. There won't be much of a weight gain. And also the baby can develop a lot of colic issues because the baby will be gulping in a lot of air while drinking milk, and that in turn gradually can lead to incomplete breast emptying and further poor milk supply further. So how do you address this issue? So the first thing is it is important to assess and look for this particular problem by a professional, either a lactation consultant or a pediatrician, and you can refer to a pediatric dentist if you feel there is a need for surgical release. And the most important thing in such a scenario is you have to ensure that the latch is deep and not only on the nipple or so at least you will try. So you can try different positions like laid back position, football hold, sideline. We'll see all of these positions in our further slides. And you have to ensure a deep latch. And monitoring the baby is important for the weight gain especially. And if you feel that the feeding is improper, the baby is not gaining weight, mother is having severe pain while feeding, you have to release the lip tie or the tongue tie, which usually a dental surgeon or a pediatric surgeon does. And post surgery also you have to give constant support to the mother. You have to refer her to a lactation consultant. You have to ensure that the oromotor exercises are being done to prevent reattachment and thus ensuring further weight gain of the baby. Okay. So second scenario is of that of a preterm baby. Yeah. So the challenges that we normally face in a preterm baby is they'll have a weak suck swallow reflex. There will be inability to coordinate breathing and feeding together. Lot of because of various complication, there will be a prolonged NICU stay. The mother would be separated, though there could be issues in terms of breast milk supply, and also there will be increased nutritional needs of the baby. So how do you approach in such scenarios? So first thing, even if the baby is separated, say a very small baby in the NICU, the mother should be told to express from day one itself every 2 to 3 hourly to ensure that the breast milk output supply is maintained. Okay. Secondly, if a baby is say too small, 28 weeker, 29 weeker, of course we cannot start oral feeds. So below 32 weeks, we usually start with OGT feeds, that is orogastric tube feeds. And as soon as the baby hits, say, the 32-33 weeks mark, wherein we feel that the swallowing and the breathing coordination has been achieved. So at that time, if the baby's weight is also near to 1.4 kg, we can start with Vati spoon feeding or gavach feeding. And simultaneously, you have to ensure that the baby gets a lot of skin to skin contact, kangaroo mother care. That also improves the breast milk output, latching, and the weight gain of the baby in future. You have to ensure that the baby has been started on non-nutritive sucking. So you can use your finger or on an empty nip. After emptying the breast on the nipple, you can make the baby suckle so that the baby get used to, and the transition to breastfeeding becomes very, very smooth. And there are something called as POMI, that is premature infant oromotor intervention. So there are a steps of 8 particular steps which you can start at around 28 or 29 weeks, which will help the transition to oral feeds and breastfeeding very smoothly, even if the baby is premature. And the transition to complete breastfeeding should ideally be achieved by 2 kg of birth weight. So you can combine some amount of breastfeed at least for some time plus Vati spoon feed, and by the end of 2 kg try to switch to complete breastfeeds. So these are the different breastfeeding positions that can be tried. So in a preterm baby, so the most advisable position is a cross cradle position. That is the second figure. Okay. Or even a football position is a very practical approach for a preterm baby. And the cradle position is better when the mother is more experienced, the baby has gained some good weight. Then cradle position, the first position, can be tried. Okay, what about twins? What all challenges would the mother face if they have if she has a twin baby? So of course there's a lot of pressure on the mother because of the increased demand for milk supply, and it is a very time consuming thing. She would have sleepless nights. So managing simultaneous feeding is very difficult, and she will be obviously exhausted and fatigued. So what is the best approach in such scenario? So it is simultaneously feeding both the babies together. And how do we achieve it? So this is so one baby on each side, the mother can simultaneously feed, and it is called tandem feeding or double football hold. And she can switch. So then the next session, she can switch the babies on alternate breasts. So, and during the whole breastfeeding or the lactation duration, you have to ensure that the mother is also receiving good nutrition, hydration. And in such pregnancies, triplet and twin pregnancies, family support plays a very important role because mother alone cannot take care of both the babies. So what is this? Now this is a typical common case wherein there is a nipple damage or a nipple soreness. Yeah. So the cause of nipple, most common cause would be a poor latch. So a primary mother is not experienced, doesn't know how to latch. Maybe she's just feeding superficially on the nipple, and that will cause this problem. Or incorrect positioning while feeding, or like we already discussed, the baby might be having a tongue tie, lip tie, that can also cause this, or a dry cracked skin, or if there is a candidal yeast infection in the baby in the nipple area, or if there is a bacterial infection, all of this can lead to nipple pain and damage. So how do we address this? First thing you have to ensure is check for the latch and positioning, and if that needs correction you have to teach the mother. Second most important thing is you have to ensure that the nipple that has been injured, that needs to heal. So you'll apply either the mother's own breast milk, which has healing properties, or you apply creams like lanolin cream and nip care cream. And if you on examination, if you see that the baby has some oral restriction in the form of tongue tie, lip tie, that would need release, you have to ensure that that has been done by referring to a dentist or a surgeon, and treat sorry, treat the thrush or the bacterial infection by giving appropriate antifungal, oral antifungal, or the antibiotics if there is a need. And if there is a severe pain, you can also use a nipple shield, or for few days you can advise a mother to pump the milk out and feed the baby so that she gets some rest. And of course painkillers you'll have to give to the mother. Okay. So we have talked so much about a good latch. So what do you mean by good latch? So a good latch is wherein the baby's mouth is wide open. So it has to be almost 120 to 160-degree wide open. And you have to try to give, along with the nipple, the maximum portion of the areola should be inside the baby's mouth. So that is all of the lower areola, and at least upper two-thirds of the areola should be inside the baby's mouth. That is a deep latch. Plus, the lips should be everted outward. Okay. And the chin should be touching the breast so that the nostril is open, and you will be able to see that the jaw is constantly moving. There is, ear wiggle. You will be able to sometimes hear an audible swallow also. So these are some of the indications of a good latch, which you should always ensure during your rounds or during your OPT visits in a baby and the mother triad. Okay, so for mastitis, the second common complication, if you see this breast, it is all swollen, there is some redness. So it is inflammation and infection of the breast tissue, what we call as mastitis. It is very, very painful, and the mother will obviously, because of the swelling, redness, there will be problems with the latching. And if the mother doesn't latch, again, there will be a lot of breast engorgement, and it will only worsen the situation. So in severe cases, the mother might develop fever, abscess formation, and can lead to requirement of surgical intervention or surgical drainage of the abscess. So how do you address it? You should never stop breastfeeding in such scenarios. The breastfeeding needs to continue. The milk should get emptied out from the breast. So mother can either breastfeed or express or feed, but should continue breastfeeding. Again, correct the latch and position. And what to apply? Warm compress or cold compress? So for promoting milk flow, warm compress is always better. Okay. And gentle massage can be done. But in between the feeds, cold compress can relieve inflammation and pain. And obviously, you'll have to give painkillers like paracetamol, brufen, whatever of your choice, and antibiotics to treat the infection. Okay. So these were like one of the most common local conditions. Now, suppose if the mother has cough, cold, a fever. So in future, like most of you must be already getting questions like, okay, I have cough, cold, fever. Can I breastfeed the baby? It's one of the most common questions. So what are the challenges that the mother would face? So if there is some illness or if the mother is on some medication, obviously the milk supply would be reduced. So mother will be scared that she might transfer the infection to the baby and she'll be in a lot of discomfort, obviously. And some medications could be a contraindication to breastfeeding. So how do you address the issue? So in general, just for a common understanding, most of the cough cold medicines are safe for breastfeeding. Okay, so routine paracetamol, routine antibiotics are not a contraindication to breastfeeding. So you can safely tell her that you can continue breastfeeding and you can take your medications. In fact, the mother would in fact have a lot of antibodies against that particular infection, which will be in fact protective for the newborn baby against that particular infection. So feeding should never be stopped. Secondly, if she's confused if the baby, if those medications are safe or not, she can always take the help of a healthcare provider. And you have a lot of websites like Lactamed and other sites which will tell you if a particular medication is safe for breastfeeding or not. Okay, and you ensure that your like mother is following hygiene precautions like frequent hand wash, wearing a mask. Okay, and rest and adequate hydration wherever necessary. And because of maternal exhaustion or whatever reason, if she's not able to feed, she should at least express the milk, and that can be given to the baby by some other relative so that she can breast. Okay, another common scenario, a post cesarean delivery. So the common challenges in a post-cesarean delivery is there's issues with mobility. Of course, mother is dependent on somebody else to help with the latching part. So a lot of pain, limited mobility, skin-to-skin contact could be delayed. That can delay the lactation. Because of effect of anesthesia, again, the lactation could be the initial feeding process can be delayed. And separation is one of the factors. Suppose if she needs to be monitored and if the baby has been separated for a long time, that can also affect the milk output. So how do you address it? Even in a cesarean delivery, we should attempt for early initiation of breastfeeding within the first hour of life as much as possible. And by ensuring the early initiation of breastfeeding and by ensuring early kangaroo mother care or skin to skin contact, most of the mothers can still, we can expect to be on exclusive breastfeeding without formula, even if the baby is born by a cesarean section. Okay, so it's not a norm that if the baby is born by cesarean section, you have to give formula, nothing like that. So in our hospital, even with cesarean section, mostly 90% of the mothers go on exclusive breast milk feeding only. So that you ensure side lying or football hold so that the pressure doesn't come on her tummy. So she can, without any undue pressure on the tummy, she can ensure that she's lying down and feeding the baby, or the other position is the football hold, like what we saw for the twin babies. So, and of course, here also a lot of family support is needed. The hospital has to be baby friendly hospital. The nurses assistance would be definitely needed, and she can take the help of pillows to comfortably position herself for feeding. And of course, the pain management will continue. Okay, so what is this now? So this is a cleft palate and a cleft lip. So what are the problems that you expect if a baby has this issue? So obviously the latching will not happen properly. There will be issues in developing or creating suction for the breastfeeding that is required. And there will be always a risk of aspiration because the milk can enter the nasal passages. And if the feeding is poor, obviously there is a risk of poor weight gain. So how do you What do you do in such scenarios? Yeah. So firstly, see, immediately you cannot operate these babies. So till the time they reach a particular weight, you can only operate such babies at least after like around 3 to 6 months of age only. You can operate cleft lip, and cleft palate is usually the surgery is done around 9 months of age. Okay. So till that time, you have to ensure that the baby is being fed, and there's a special bottle for such babies which is called Haberman feeder. It has a long rigid nipple which will bypass the cleft palate. So you can take the help of a lactation consultant, and you'll have to really teach the parents in and make sure we'll have to make the parents confident in feeding such babies. You'll have to express and feed the baby till the surgical repair is done, because direct breastfeeding may or may not be possible in such scenarios. Okay, and you have to closely work with the team, with a pediatric surgeon, lactation consultant, and a neonatologist. And in the during all of this process, you have to ensure a lot of skin to skin contacts. There have been scenarios wherein we could not start oral feeds, and we had to teach mother tube feeding, OGT feeding, until the baby, after achieving a certain good weight only, then we could proceed with surgery, and then we could start the breastfeeding. So there are scenarios wherein oral feeding may not be possible at all before the surgery. Okay. Okay, what about infections like HIV and other infectious diseases? So in that cases, mother will be scared of risk of virus transmission through breast milk. And also there can be a lot of fear, stigma, misinformation about safety. So what is the protocol that we should follow? So in general, in HIV, antiretroviral therapy, if the mother has taken complete course, it is considered safe. Okay. Of course, it is the parent's choice. But remember, never ever mix feed. Mix feed as in, she has to decide whether she wants to formula feed and not do breastfeeding at all, or she'll have to do only exclusive breastfeeding. Okay. So mixed feeding is contraindicated. And if then the guidelines, you'll according to the WHO current guidelines, you'll have to follow. What about hepatitis B, hepatitis C? Again, it is not a contraindication to breastfeeding. Uh, Active untreated tuberculosis. Again, in that case, after 2 weeks of AKT, you can resume breastfeeding if the mother is untreated and there is active COX. What about chickenpox? Chickenpox, say if the lesions are present, active lesions are present on the breast, then you may have to tell her to express and feed, and in that case, direct skin contact may have to be avoided. Okay, these are some specific situations about the infections. Then coming to maternal mental health conditions. A lot of hormonal fluctuations would happen during the postpartum period, and there's a very high risk for the mothers to go into postpartum depression and anxiety. So the challenges that the mother would face is she may have a lack of motivation in general or energy to breastfeed, and also the medications. Some medications may be not very safe for breastfeeding in such scenarios, and also she would be in a lot of guilt and pressure from friends and family because of the feeding decisions. So how do we help her in such scenario? So, mental health support through therapy, you have to consult a psychologist or a psychiatrist, and you can opt for a safer medication which is breastfeeding friendly. Okay, so and the family involvement or the father's involvement in the baby's routine and care is very important for the quick recovery of the mother and for ensuring a smooth breastfeeding journey. And we have to prioritize mother's well-being first, and the feeding plan has to be flexible in such scenarios. Okay, what about working mothers, and or if she wants to return early to work? So again, that puts a lot of stress on the mother. That how will she maintain the milk supply? There will be time constraints, lack of facilities, stress. So all of this can have a can stress out the mother. So how will you help her? So you can tell the mother that she can have a pumping schedule even during working hours. She can buy a pump, she can pump at her workplace and store the milk in the fridge. And in for storage, that at room temperature the milk can be stored for good 4 to 6 hours. And if she keeps it in the fridge, it can be stored for as long as 3 days also, provided she keeps it not in the door and the main compartment of the fridge. And if she wants to freeze the milk, it can be stored for months also. Okay, so you can give her that option. And she can take the help of lactation consultant, and she can take the help of her colleagues who have had a similar situation before. And yeah, so that is what we can do. And suppose if the baby is already 6 months and above, where the solid foods have been started, then it is not a problem, because the baby is not solely dependent on the breast milk of the mother. Okay, what about relactation? So relactation is if you want to start again lactation after, for some reason, if the mother has already stopped lactating or stopped breastfeeding, and if you want to start again, so that is what we call relactation. So in such scenarios, again, like the pressure of regaining milk supply, the baby might not want to latch on the breast, a lot of emotional stress. So what do you do? So to ensure that the mother lactates again, the first thing you do is advise her frequent pumping. Huh? And you have to make the baby suckle on the nipple. That will stimulate the milk output. So 8 to 12 times per day is advised. And you can take the help of medication like domperidone or other galactologues under supervision only, and a lot of skin to skin contact to encourage latching. Skin to skin contact also helps in the release of good hormones, endorphins, oxytocin, prolactin, that will ensure that the milk output is achieved. And there is something called as supplemental nursing system that also can help in relactation. So what is supplemental nursing system? So basically it is a device wherein a mother can give her expressed milk or formula or even donor milk on the breast itself. Okay, so this will help the baby suckle, receive nutrition, and that suckling will further stimulate her own milk output. Okay, yeah. Coming to babies with disabilities, for example, Down syndrome. Now, the challenge with Down syndrome is the baby will be hypotonic, may have a weak suck, okay, and the baby can easily get fatigued during the feeds, and there can be issues with coordination also while feeding, breathing, swallowing, coordination. So what do you do? What is the best position to latch in such babies? So the position is upright hold. So the baby would be upright, and you will support the chin of the baby. So like in this figure. So this is also called dancer's hold. Okay. So this is the best position to feed directly on the breast in a Down syndrome or a hypotonic baby. And because the baby may not sustain the latch for a very long duration, you may have to give frequent but short duration feeds, and it requires a lot of patience. And these babies may have speech problems and other issues, so you can involve the other therapist also, the feeding therapist, the speech therapist, the lactation consultants, pediatrician. There can be problems with hearing, so you'll have to, it's a multidisciplinary approach, you'll have to involve everybody in their care. Okay, now adoption surrogacy is also becoming common nowadays. So what do we do in such scenarios? So again, the challenges would be there won't be, of course, any natural lactation in such scenarios. So you can trigger the lactation So later on that we'll see how to do it. The mother may not feel any bonding with the baby, obviously. There won't be initial colostrum, of course, and there will be a lot of societal emotional pressure and judgment from the family members. So in such scenarios, you can still help the mother with lactation. She can still breastfeed even if the baby is not the biological child of the mother, by inducing her lactation using hormonal therapy and mechanical stimulation. Stimulation is pumping and nipple stimulation. Okay, and hormonal therapy is domperidone or metoclopramide tablets. You can start the mother well before you're expecting the baby to arrive. Okay, and the supplemental nursing system can also be used along with breastfeeding it will stimulate the breast output. Basically, the baby will be receiving milk from a bottle. So the same what we saw here. So a bottle will be attached, and through a small pipe, the baby would be receiving breastfeeding as well as supplemental formula or donor or expressed milk along with it, and this will stimulate her milk further. Okay, and she can do a lot of skin to skin contact and a lot of good encouragement, emotional support, lactation, frequent lactation consultation can ensure that she's able to breastfeed her adopted or even if it is a baby by a surrogacy. Okay, so these are the scenarios that you will most commonly face, and I try to cover all the uncommon scenarios or the challenges that you could face. uh, so if you want to go deep into the topics, so for example, like I told, if you are working in an NICU and you want to help a baby reach faster oral feeds and you want to shift the baby out early, you can, along with KMC, you can do something called as oromotor exercises, and the it will take around 5 minutes for the mother to do it. And for the exact details and stepwise thing how to do it, you can go to the YouTube. I have posted videos on it on my YouTube channel. And if you feel you have any doubts, you can ask here also. And later also, if you feel you have some queries related to breastfeeding or anything with respect to a neonate or a baby, you can drop a message on my Instagram ID. Okay. And also, if you have queries related to latching issues, what food the mother can take to increase breast milk supply, you can check on my YouTube channel. So that's it from my side. Uh,
Thank you, ma'am.
yeah. Most welcome.
Ma'am, there is a doubt by a student.
Hmm?
He is asking that how to approach a case of
Hmm?
breast milk jaundice.
Okay, so I've seen a lot of practitioners sometimes they advise that breast milk should be stopped. That is absolutely not needed. So basically, breast milk jaundice is because of some substance, particular substances in the breast milk. It is assumed that the jaundice, there can be a prolonged jaundice. Okay, so it is always remember it is a diagnosis of exclusion. So if you feel everything else has been ruled out and still if the baby has jaundice, a prolonged jaundice, then we usually label it as breast milk jaundice. So basically the approach is the same. You have to ensure that the baby is well fed. No need to stop the breast milk. Please don't do that. And many of such cases, sometimes if it is really high and the baby is requiring repeated phototherapy admissions, it could also be Krigler-Najjar type 1, type 2. It can fall into those categories also. You should investigate if the baby really has prolonged jaundice and is requiring multiple admissions. But absolutely, there is no need to stop the breastfeeding for breast milk jaundice. Did that answer your query?
Yes, ma'am. I think the student is satisfied. Ma'am, next question is by Dr. Deepak Kaluram.
Hmm?
Uh, He says parent has approached to my OPD saying that the baby passes stool immediately after feeding. After taking detailed history and doing relevant examinations, I have diagnosed the case as exaggerated gastrocolic reflex. I felt difficulty in counseling the parents. So, what are the points to consider in counseling such cases rather than treating it?
See, what I usually do is at the time of discharge only I tell them what to expect. So, it for in a newborn baby, especially during the initial months, it is normal for the baby to pass sometimes 15 motions, very frequent motions, green colored, watery. Sometimes is also expected to be normal because of the quick gastrocolic reflex. Yes, that is right. And it needs no treatment if there are no other associated complaints. Like if the baby is gaining weight nicely, if the baby is feeding well, it is expected. Okay, so all you need to do is counsel the parents well, and there's absolutely no need to treat the baby. And if you're in doubt, say if the mother is say bottle feeding or there is a formula feeding history where you think there could be a contamination or there is a risk of say viral diarrhea or something, then you can take a proper history, see if the stools are extremely watery, baby is not gaining weight, there is vomiting, the lethargy if associated with other complaints, then of course you'll think of an infection and you may have to treat or monitor the baby. But routinely, yes, if there are no other complaints, then frequent motions or even infrequent motions. Say if the baby is not passing motion for 7 to 10 days, it is normal. The only condition you will check is thyroid. Hypothyroidism is one thing where there can be constipation. But apart from that, if the baby is happy and even if the baby is not passing motion for say 7 to 10 days, it is normal. So my advice would be on the first attempt, first visit or before discharge only, you counsel them what to expect. Like hiccups are normal, sneezing is normal, infrequent passing of motions is normal. I've seen some doctors treat even rashes, the initial erythema toxicum, some rashes. They are very common in newborn babies. You don't need to treat it. They will disappear on their own. So I think counseling plays a very important role, especially in the newborn period.
Thank you for the clarification, ma'am. I again
Yeah.
thank you for incredible, insightful, and empathetic presentation on breastfeeding in special circumstances. Your expertise and compassionate approach provided invaluable strategies and guidance, empowering us to better support mothers and babies facing unique challenges. It was an outstanding and deeply important session. Thank you, ma'am.
Yeah. Thank you so much, Umer, right?
Yes, ma'am.
Yeah, thank you, Umer, for that introduction. And also thank you to Dr. Abhishek. So we work together in KM Hospital, Pune. That is how I got this opportunity to talk on this platform. Yeah, so thank you for approaching me. And if you have any query of any sort, you can, even in future, you can always WhatsApp me or pin me on my Instagram. Okay? Chalo. Bye.
Thank
Take
you for
care.
your support, ma'am. Thank
Yes,
you.
yes. Most welcome.
Now I would like to call Dr. Abhishek sir, Professor of Department of Kamara Vridya, Ashwini Ayurvedic Medical College, for report reading and announcement of winners. You may take the podium, sir.
Thank you, Mr. Umar. Yes, myself, Dr. Abhishek, Assistant Professor, Department of Ayurveda Pediatrics, hereby in front of you to present the report of Baalajeevanam National Level Conference on the occasion of World Breastfeeding Week.
Sir, you're visible now.
Okay, thanks for the confirmation. Yeah, in the honor of World Breastfeeding Week 2025, the Department of Kaumarvidya at Ashwini Ayurvedic Medical College and Research Center, Tumkuru, in collaboration with the Pediatric Society of India, NEMA, proudly hosted the Baalajeevanam. With a shared vision to elevate pediatric care and academic excellence, the event embraced this year's global theme, prioritize breastfeeding, and create sustainable support systems by fostering dialogue, innovation, and interdisciplinary collaboration. Baalajeevanam featured a dynamic lineup of activities designed to engage and inspire participants, including scientific oral paper presentations, essay writing competitions, poster making contests, and expert sessions. The event received an overwhelming response with over 1,689 registrations from 21 states and more than 162 institutes across the India. Participants included 1,226 undergraduate students, 231 postgraduate students, 12 PhD researchers, 43 practicing clinicians, and 173 faculty members. The heart of Baalajeevanam was the scientific oral paper presentations held on August 4, where participants showcased their clinical experiences, observational studies, literary reviews, and research comparisons. A total of 184 oral paper presentations was done across 16 parallel sessions, chaired by 32 distinguished pediatric experts invited from across the country. The breakdown of presenters included 41 undergraduate students, 89 postgraduate scholars, and 54 faculty members, practitioners, and PhD scholars. Complementing the academic rigor were the essay and poster competitions, which saw enthusiastic participation. The undergraduate essay section received 318 entries, while the poster making contest featured 242 vibrant and creative submissions advocating for breastfeeding and pediatric wellness. Today, that is August 6, 2025, four informative and thought-provoking sessions were conducted, focusing on the theme prioritize breastfeeding, create sustainable support systems. The sessions were designed to enhance awareness, break myths, and promote evidence-based practices for improving breastfeeding support systems in pediatric healthcare. First and foremost, Dr. Srinidhi Kumar Acharya sir delivered the keynote address, setting the tone for the conference by emphasizing the importance of prioritizing the breastfeeding as a public health necessity. He highlighted sustainable support mechanisms, the role of healthcare professionals, and the policy initiatives needed to ensure optimal breastfeeding practices across the communities. Then followed by the session one, which was handled by Dr. Priyanka Kiran Bairagi. Topic was an insight into the myths, misconceptions, and the FAQs of breastfeeding. This session focused on identifying the prevalent myths surrounding breastfeeding and provided the scientific explanations to dispel misconceptions. Dr. Priyanka Kiran Bairagi discussed cultural, societal, and medical barriers affecting the breastfeeding and recommended the effective communication strategies to improve awareness among mothers and caregivers. Followed by the session 2, which was handled by Dr. Lakshmi M.K. Madam from Kerala. Her topic was Ayurveda and traditional systems in promoting and supporting the lactation. Dr. Lakshmi M.K. Madam presented an in-depth analysis of Ayurvedic approaches to promoting lactation. She elaborated on the use of herbal formulations, dietary recommendations, and holistic postpartum care in Ayurveda that contribute to enhancing breastfeeding outcomes while supporting maternal health naturally. The last session, which was handled by Dr. Anusha Rao Madam, the topic was breastfeeding in special circumstances. Dr. Anusha Rao Madam addressed the challenges faced in special circumstances such as preterm deliveries, maternal illness, and neonatal complications. She shared clinical guidelines, case studies, and strategies to ensure safe breastfeeding practices even in high risk or complex situations, emphasizing the role of multidisciplinary care. Overall, the sessions provided valuable insights combining traditional wisdom with modern medical approaches to improve breastfeeding support. The discussions reinforced the central theme of Baalajeevanam 2025, fostering collaborative learning among participants and paving the way for innovative solutions in pediatric care. Now we are thrilled to announce the winners of national level oral paper presentation competition, essay writing competition, and poster making competitions. Their work exemplified research excellence, eloquence, and innovation, truly reflecting the spirit of this year's theme. The first is poster making competition. Out of 242 posters, the first prize, the second prize was backed by Mr. Abhishek G. Joshi. He is from Manjushri Research Institute of Ayurvedic Science, Gandhinagar, Gujarat. I repeat, Mr. Abhishek G. Joshi, Manjushri Research Institute of Ayurvedic Science, Gandhinagar, Gujarat. Congratulations. And the first prize for poster making competition backed by Ms. Lakshmi Neelakant Bhavikatti from SMVV's RKM AMCH Vijayapura. I repeat, Ms. Lakshmi Neelakant Bhavikatti, SMVV's RKM AMCH Vijayapura. Congratulations to you also. And the consolation prize was given to Mr. Jaihindam Hardi Parshakumar from Sri RMD Ayurveda College and Hospital, Valsad. I repeat, consolation prize for the poster making competition was backed by Mr. Jaihindam Hardi Parshakumar, Sri RMD Ayurveda College and Hospital, Valsad. Congratulations to you also. So this was about poster making competitions. Next is essay writing competition. So overall, we have received 388 entries for the essay writing competition, which was kept for UG students. The second prize has been backed by Ms. Ashwini Mallipatil from DGM Ayurveda Medical College and Hospital, Gadag. Ashwini Mallipatil from DGM Ayurveda Medical College and Hospital, Gadag. Congratulations. First prize by Sayeda Khatijatul Kubra. I repeat, Sayeda Khatijatul Kubra from Ashwini Ayurveda Medical College, Tumkur for first prize essay competition. Congratulations. Consolation prize has been backed by Ms. Sahana S. Patil. Consolation prize for essay writing competition backed by Sahana S. Patil from Sanjeevani Ayurveda Medical College and Hospital, Hubballi. Congratulations to you also. The next is paper presentation competition. Total there were 184 paper presentations which was held across UG, PG, faculty, PhD and practitioners. Session 1 prize goes to Mr. Raj Agarwal from STM Ayurveda Medical College, Bangalore. Session 2, Ms. Lakshmi Neelakanta from RKM AMCH, Vijayapura. Session 3, Ms. Supriya MN, Ashwini Ayurveda Medical College, Tumkur. So these are the 3 sessions for UG. So from session 4th onwards, it was for PG's sessions. It was for PG's. Session 4, Dr. Namita from All India Institute of Ayurveda, New Delhi. Session 5, Dr. Sukanya Basuri, JSS Ayurveda Medical College, Mysuru. Session 6, Dr. Reshmi from Sri Sri College of Ayurveda, Bengaluru. Session 7, Dr. Sushantika Deshpande, Bharatiya Vidyapita, Pune. Session 8, Dr. Pooja Rose, CJ, Government Ayurveda Medical College, Kerala. Session 9, Dr. Richa Jangapangi from ITRA, Jamnagar. Session 10 by Dr. Vaishnavi Joshi, Taranath Ayurveda Medical College, Ballari. Session 11 by Dr. Avinash, Alwas Ayurveda Medical College, Moodbidre. So these were the PG sessions for paper presentation competition. Congrats to all of you. Next is for faculties, PhD scholars and practitioners. Session 12, Dr. Rajani Paidi from Nobel University, Gujarat. Session 13, Dr. Vinod Patil, Dr. D.Y. Patil School of Ayurveda from Navi Mumbai. Session 14 by Dr. Kavita D, SBV's JVM Gramin Ayurveda Medical College, Terdad, Karnataka. Session 15, Dr. Tejaswini, SMVV's RKM AMCH, Vijayapura. And session 16, Dr. Shilpa Karadi from SSAMC, Haveri. So these were the faculty sessions for paper presentation competition. Congratulations to all of you. So Baalajeevanam was more than an academic event. It was a movement to prioritize breastfeeding and build sustainable support system for the child health. Through shared knowledge, passionate participation, and expert guidance, the initiative continues to innovate, inspire, and shape the future of pediatric care. Thank you so much, and over to you, Mr. Kumar.
As we come to the close of Baalajeevanam 2025, my heart is full and I'm sure yours are too. It feels like just a little while ago when we began this incredible journey together, united by a shared purpose and a deep commitment to the well being of mothers and children. Over these 6 hours, we have absorbed so much, not just knowledge and data, but stories, wisdom, and a renewed sense of purpose. We have been reminded that breastfeeding is not merely a biological act, but a beautiful, profound culture that nurtures life, fosters bonds, and creates healthier, happier families. Now, I would like to call Dr. Minakshi Ma'am, Associate Professor in Department of Kamarapritya, Ashwini Ayurvedic Medical College, Research Center and Hospital, to conclude the event by delivering vote of thanks. Over to you, Dr. Minakshi Ma'am.
I'm visible. Am I audible?
Yes, ma'am.
Thank you, Umair. Namaste, everyone. As Umair mentioned, myself, Dr. Meenakshi, Associate Professor, Department of Kamarapritya, Ashwini Ayurvedic Medical College, Tumkur. It's my privilege to be part of Thanksgiving note for today's event. As we all know, August 1st week is celebrated as World Breastfeeding Week, and we, Department of Kamarapritya, Ashwini Ayurvedic Medical College, Tumkur, in association with NIMA PSI, organized a national level conference on behalf of this. And as we all know, the conference has come to its end and we are celebrating a successful completion. But this successful completion of end part was not so much successful without the support of you all. So I am here to extend my heartfelt thanks for you all, for participating actively in our conference. Initially, I would like to thank today's chief guest who accepted our invitation and spent this precious time with us. Firstly, I'd like to thank Dr. Srinidhi Acharya sir, who thrown light on theme of 2025 World Breastfeeding Week, that is, prioritize breastfeeding, create sustainable support system. Thank you, Srinidhi Acharya sir. Next, I would like to thank our resource persons. Firstly, Dr. Lakshmi ma'am, who explained the tradition way of lactation, supporting the system of lactation. Thank you, Dr. Lakshmi ma'am. Next, Dr. Anusha Rao ma'am, who explained the handle of special circumstances, how to handle the breastfeeding. The session was very informative, ma'am. Thank you, Dr. Anusha ma'am. And the representative of our organizing team, that is Dr. Priyanka Bairagi ma'am, who explained the myths and the frequent asked questions about the breastfeeding, which is very necessary for today's generation. Thank you, Dr. Priyanka. Next, I would like to thank the chairpersons. As we all know, on 4th of August, we conducted paper presentation and several 25 to 30 chairpersons of our especially Department of Kamarapritya's staff all over the, it made we can say all over the other states also, even Karnataka and other states persons, faculties also took part, and they assist the paper presentators. So I would like to thank the all chairpersons who participated on 4th August in paper presentation sessions. Now coming for the main persons, for whom this conference was arranged, and the reason with whom our conference is successful, that is our delegates and also the students and faculties who took part in paper presentation, essay competition, and poster presentation. I congratulate them, and even I like to thank them for active participation. And I like to thank any event, like any institutional event is not complete or not successful without the support of principal of the institute and also the management of the institute. So I like to extend my thanks for our principal sir, Dr. Nagaraja JM sir, for their support throughout the conference. And also I would like to thank our management. Without the second thought, when we approached about the conference, they gave us or they approved the plan and they gave us permission. I like to thank them. And last but not the least, the students of our third phase Ashwini Ayurvedic Medical College, Tumkur, who were also the volunteers of this Baalajeevanam. Without their support, the Baalajeevanam conference was incomplete. They are the backbone of our conference. So I would like to thank them, and thank you, one and all. Over to you, Mike.
Thank you, Dr. Meenakshi ma'am. It was my immense pleasure to be a part of such wonderful event, that too of a national level. Baalajeevanam has taught us many things, and the purpose, and we will make sure that the purpose is fully well served. Thank you. Special thanks to Dr. Abhishek sir and our principal sir, director sir. Hope to see you next year in Baalajeevanam 2026. Till then, goodbye.